My daughter sitting there, it's okay.
Ya, Mbak. Ya, Mbak. Ini mau, iya bentar ya.
Profesi.
Oke, gitu.
Profesi.
Ini ya.
Masa depan negara tidak hanya berpangku pada pendidikan yang baik, tetapi juga ditentukan oleh kesehatan yang baik. Masih banyak wilayah negeri ini belum tersentuh oleh layanan kesehatan. Untuk itu, Poltekkes Kemenkes Tanjungpinang sebagai pencetak calon tenaga kesehatan yang harus memulai itu dalam membantu penyerapan tenaga kerja kesehatan yang semakin tinggi permintaannya. Pulau Bintan adalah tempat yang indah dan menjadi destinasi wisata dunia. Dan Tanjungpinang adalah sebuah kota bersejarah yang pernah menjadi pusat peradaban kebudayaan Melayu. Ibu kota Provinsi Kepulauan Riau yang juga dikenal karena keramahannya, kemajemukannya, dan kebudayaannya, termasuk diantaranya sektor kesehatan. Kondisi geografis kepulauan menuntut ketersediaan tenaga kesehatan yang tidak saja banyak jumlahnya, tapi juga berkualitas sumber daya manusianya. Politeknik Kesehatan Kemenkes Tanjungpinang sebagai kampus negeri pertama di Kepulauan Riau hadir dan mengambil peran dalam memastikan ketersediaan tenaga kesehatan. Didirikan pada tanggal 27 September 2011, kampus ini sudah mencetak ribuan alumni yang telah tersebar di seluruh penjuru negeri. Kami bertekad memberi ruang serta kesempatan yang sama bagi siapa saja untuk berpartisipasi dalam mewujudkan visi menjadikan perguruan tinggi bidang kesehatan yang bermutu, berdaya saing, dan berintegritas di tingkat nasional tahun 2024. Pentingnya prinsip sebagai panduan dalam berkehidupan, kami berkomitmen untuk melaksanakan Polkestan bertanjak, bertanggung jawab, santun, jujur, amanah, dan komitmen. Mewujudkan visi dan misi adalah proses yang panjang. Saat ini, kita bertekad mewujudkannya melalui 3 program studi. Program studi D3 Kebidanan, program studi D3 Keperawatan, program studi D3 Sanitasi. Kampus ini meraih banyak penghargaan nasional, sudah terakreditasi institusi dengan nilai B. Poltekkes Tanjungpinang meraih juara 2 dalam perlombaan TTG CKM 2021. Kita juga mendapatkan medali emas untuk teknologi tepat guna dalam kegiatan Global Competition Life for Science tingkat internasional tahun 2021. Sukses dimulai dengan keberanian, memulai untuk perubahan. Langkah kakimu hari ini akan menentukan masa depanmu di masa yang akan datang. Karena kamu adalah calon pemimpin di bidang kesehatan. Kami adalah tenaga pendidik yang siap untuk membantu kamu dalam mewujudkan mimpimu. Itu mengapa kelas kami bukan sekedar tempat belajar, melainkan ruang tumbuh bagi calon tenaga kesehatan terbaik yang siap melayani sepenuh hati. Laboratorium kami adalah inkubator ide, gagasan, dan inovasi yang senantiasa dikembangkan tanpa henti-henti. Zaman terus bergerak, tantangan menanti di depan, perlu disongsong dengan semangat inovasi agar memiliki daya saing dan bermutu tinggi. Kampus yang berdedikasi senantiasa melahirkan tenaga kesehatan terbaik guna mendukung visi Indonesia Sehat menjadi nyata. Dari kota Tanjungpinang di Pulau Bintang, aku berjuang menapak masa depan untuk berani bermimpi besar. Aku percaya hidup yang baik itu dimulai dengan keberanian dan dituntun oleh pengetahuan. Setiap langkah kecil ikut berperan dalam mimpi besar mengubah dunia menjadi tempat yang lebih baik untuk ditinggali bersama, menjadi rumah yang lebih hangat untuk dihuni semua. Jernih laut Bintan, ombaknya tenang, jadi tujuan banyak pejalan. Inilah Poltekkes Kemenkes Tanjungpinang, tempat kelahiran tenaga kesehatan andalan.
Mari bergabung dengan Poltekkes Kemenkes Tanjungpinang.
Anaknya, Bu. Oh ini ya, Bu. Mau mulai kan?
Keperawatan meyakini bahwa manusia dan kemanusiaan merupakan titik sentral setiap upaya pembangunan dengan menjunjung tinggi nilai-nilai kemanusiaan. Pelayanan keperawatan berupa bantuan yang diberikan karena adanya kelemahan fisik dan mental, keterbatasan pengetahuan, serta kurangnya kemauan menuju kepada kemampuan melaksanakan kegiatan sehari-hari secara mandiri. Bantuan keperawatan diberikan agar individu, keluarga, kelompok, dan komunitas dapat mandiri dalam memelihara kesehatannya sehingga berfungsi secara optimal. Poltekkes Tanjungpinang dulunya merupakan bagian dari Poltekkes Riau. Setelah memenuhi persyaratan, Poltekkes yang berlokasi di Tanjungpinang ini secara resmi berdiri pada tanggal 27 September 2011. Akreditasi keperawatan adalah akreditasi B. Sebagai bagian dari Poltekkes Kemenkes Tanjungpinang, Prodi D3 Keperawatan Poltekkes Kemenkes Tanjungpinang memiliki visi menghasilkan lulusan ahli media keperawatan yang bermutu, berdaya saing, dan berintegritas yang unggul dalam keperawatan gawat darurat wilayah kepulauan di tingkat nasional tahun 2024. Dan misi 1. Melaksanakan Tridharma Perguruan Tinggi untuk pengembangan pengetahuan dan teknologi keperawatan dengan keunggulan gawat darurat wilayah kepulauan yang bermutu, berdaya saing, dan berintegritas. 2. Mengembangkan tata kelola program studi D3 keperawatan yang kredibel, akuntabel, dan transparan yang dilandasi oleh etik dan moral. 3. Mengembangkan kerjasama Tridharma Perguruan Tinggi bidang keperawatan dengan keunggulan keperawatan gawat darurat di wilayah kepulauan dengan pemangku kepentingan baik di dalam maupun di luar negeri. Prodi D3 Keperawatan memiliki struktur organisasi yang utuh dan memiliki SDM yang luar biasa. Hingga kini telah ada 14 dosen terbaik di bidangnya, 4 laboran serta tenaga kependidikan yang ahli di bidangnya, yang mencakup peranata laboratorium pendidikan, administrasi, pustakawan, teknisi, hingga programmer. Adapun kepemimpinan lainnya berupa Tenaga Kependidikan D3 Keperawatan Poltekkes Kemenkes Tanjungpinang konsisten memberikan pelatihan-pelatihan fungsional kepada tenaga pendidik dan terus berinovasi untuk mencetak generasi ahli media keperawatan yang bermutu, berdaya saing, dan berintegritas. Terbukti, sejumlah produk penelitian yang inovatif dan berdaya guna berhasil diciptakan dengan memanfaatkan kearifan lokal daerah kepulauan. Tidak hanya itu, produk yang dihasilkan juga teknologi tepat guna, buklet, prestasi-prestasi yang didapatkan dari tenaga kependidikan, bidang BMN, serta arsiparis Poltekkes Kemenkes Tanjungpinang dan Best Oral Presentation dalam International Conference dan berbagai prestasi lainnya. Prodi D3 Keperawatan Poltekkes Kemenkes Tanjungpinang berkomitmen menyediakan sarana dan prasarana terbaik untuk menunjang proses pembelajaran. Sebagai institusi yang besar, Poltekkes berdiri di atas lahan seluas 1,2 hektar. Mulai dari gedung perkantoran yang representatif, ruang kuliah yang nyaman dan modern untuk diisi 40 mahasiswa. Gazebo, asrama, ruang musik. Untuk meningkatkan aktivitas mahasiswa selama di kampus, turut disediakan perpustakaan dengan koleksi referensi yang memadai. Ruang konseling dan pendidikan kesehatan aula serbaguna. Ruang kegiatan organisasi mahasiswa. Layanan kesehatan, hingga beragam laboratorium sebagai tempat praktik mahasiswa, seperti labor keperawatan gawat darurat, labor keperawatan dasar dan keperawatan medikal bedah, labor maternitas, labor anak,
Nggak pede.
Assalamualaikum warahmatullahi wabarakatuh. Good morning and may best regards upon us all. I would like to say welcome to opening ceremony of the first International Conference Center of Excellent Health, Polytechnic Ministry of Health Tanjungpinang 2023 Public Health on Islands. His Excellency, the Head Officer of Health Department Riau Islands Province, Muhammad Bisri SKM MKes, the Honorable Director of Polytechnic Ministry of Health Tanjungpinang, Mr. Iwan Iskandar SKM MKM, to our speakers, the Honorable Dr. Saiful Nizam bin Subari MBBS, Family Doctor in Charge, My Health Medical Center, Singapore, the Honorable Sudirman The Honorable Sudirman bin Ohman, RNBS and MPH, MRCNA founder and Clinical Director Holistic Health Private Limited, Australia. The Honorable Dr. Iccoe Ngurah Edi Putra, Postdoctoral Research Associate, Department of Psychology, Institute of Population Health, University of Liverpool, England. The Honorable, the Head of Midwifery Department, Polytechnic Ministry of Health, Tanjungpinang, Ms. Rahmadona MCAP. The Honorable, the Head of Nursing Department, Polytechnic Ministry of Health, Tanjungpinang, Ms. Nurse Romalina SCAP MCAP. The Honorable, the Head of Environmental Health Department, Polytechnic Ministry of Health, Tanjungpinang, Ms. Weni Angelina MSc. The Honorable, the First, Second, and Third Vice Directors. The Honorable Center of Management, including Student Academic Administration Unit and General Administration Unit. The Honorable Chief of Internal Compliance Officer. The Honorable, the Head of Center of Education Development, Research Center and Community Services, and Center of Quality Assurance, and all of our dearest guests. First of all, let's praise, worship, and gratitude to Allah Subhanahu wa Ta'ala because of His grace and blessings. We can gather in this hall with health, goodness, and ease so that we can participate in this event of the first International Conference Center of Excellence Health, Polytechnic Ministry of Health Tanjungpinang 2023, Public Health on Islands. Secondly, salawat and salam be upon our Prophet Muhammad sallallahu alaihi wasallam by reciting Allahumma salli ala Muhammad wa ala ali Sayyidina Muhammad. Ladies and gentlemen, before we start this event, allow me to read the agenda of today's event, consisting of first, singing the Indonesia's national anthem, Indonesia Raya, followed by Polytechnic Ministry of Health Tanjungpinang's anthem. Second, praying session. Third, opening speech by the Director of Polytechnic Ministry of Health Tanjungpinang to Mr. Iwan Iskandar SKM MKM. Fourth, keynote speech by the Head Officer of Health Department Riau Islands Province, Muhammad Bisri SKM MKes. And fifth, group photo session. Ladies and gentlemen, to start the event in this morning, let's sing the Indonesia's national anthem, Indonesia Raya, followed by March Poltekkes Kemenkes Tanjungpinang. The audience, you may please to stand.
Menteri Kesehatan Tanjungpinang, transportasi Guru Kesehatan Tambal Perguruan Tinggi Kesehatan Tanjungpinang, kesehatan angkat dari prajurit saya buktikan pada negara haruskan kepunyaan dia pengabdian kita katalah cita-cita kuatkan semangat bangga merah Menteri Kesehatan Tanjungpinang
The audience, you may back to your seat. Ladies and gentlemen, let's take a brief moment to pray so we have a smooth start for our event this morning. We will pray according to our respective beliefs. Pray start. End of prayer. Ladies and gentlemen, we will continue with the opening speech by the Director of Polytechnic Ministry of Health Tanjungpinang. To Mr. Iwan Iskandar SKF, may you please.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. The Honorable Dr. Saiful Nizam bin Sahari MBBS, in charge my health medical center Singapore. The Honorable Mr. Sudirman bin Othman, founder and clinical director of Holistic Health PTA Ltd Australia. The Honorable Dr. Igusti Ngurah Edi Putra, postdoctoral research associate, Department of Psychology, Institute of Population Health, University of Liverpool, England. The Honorable the Head Officer of Health Department, Rio Islands Province. The Honorable Vice Director, the Honorable the Head of Academic Administration Division, the Honorable Chief of International Compliance Officer, the Honorable the Head of Center of Research Center and Community Services, the Honorable the Head of Center of Quality Assurance, Education Development and Center of Excellence, the Honorable the Head of Department of Nursing, Midwifery and Environment Health, distinguished high guests. Beli nasi di rumah makan, sehingga sebentar membeli pisang. Selamat pagi kami ucapkan di Poltekkes Kemenkes Tanjungpinang. In presence of God Almighty, because of the abundance of His mercy and grace, we still have strength and health. Until now, we can still carry out of opening activities for the first International Conference Center of Excellence, Health Polytechnic Ministry of Health Tanjungpinang 2023 Public Health on Islands. To be said and spell salawat to greet Prophet Muhammad Sallallahu Alaihi Wasallam by mentioning Allahumma sholli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. The development of a country is in line with the use of science, technology, and the arts. Then the use of science and technology will be able to increase the national competitiveness through effective and efficient management of its resources of cover all aspect of life, especially the development of the health sector. The geographical condition of the archipelago requires the available of health workers who are not only numerous in number but also in terms of human resources quality. On behalf of Polytechnic Kemenkes Tanjungpinang, the one and only state health polytechnic in Kepulauan Riau, we look forward to welcoming you all of the main event of health conference. As an educational institution, Polytechnic Kemenkes Tanjungpinang is highly concerned on taking a part of the improvement of the community health status and supporting health transformation program, particularly on the sixth pillar, transformation of technology. The effort of the Ministry of Health in other the strengthen science and technology institution is towards the development of the Center of Excellence of Science and Technology, Polytechnic Kemenkes, that carry out the Tridharma of higher education, which expected to be the center of the development of science and technology in the health sector in Indonesia and involve all stakeholders, hence of present public health of islands. As our issues in the first ICCOE, we are glad to be a part of Center of Excellence of Science and Technology in Indonesia, and any partner, stakeholders, colleagues, and partners all over the world of join the conference. Our experience managing ICCOE in an affirmation of provide abundant benefit for the participant. We are confident that ICCOE will have a higher scientific impact and become a memorable experience to all participants from around the world to remember. The topic chosen support the policy of Ministry of Health, the Republic of Indonesia about health transformation. Third, six pillars. Transformation of primary services, which improve promotive and preventive service, such as strengthening prevention effort, early detection, health promotion, building infrastructure, equipping facilities, infrastructure, human resource, and strengthening management in all primary service in the memory in the country. B, transformation of referral services by increasing access, quality of Indonesia hospital through center hospital program with international hospital and developing of countries of excellence. Hospital support system as education and research. C, transformation of the health country system by encouraging independence of domestic pharmaceutical and medical devices, as well as increase surveillance, networks, and the preparation of reserve health workers in responding the threat of health crisis. The transformation of health financing the effort in carry out re-ragging of financing and benefits. of the national health insurance, as well as increasing the proportion of financing for promotive and preventive service towards the addition of basic screening services for all Indonesian. Transformation of human resources by increasing the quantity, distribution, and quality of hard worker towards scholarship, empowerment of hard diaspora, and in charge of hard professional with international partners. And if transformation of hard technology by consists of the transformation of information technology and biotechnology. Dear colleagues, together, let us make ICCOD an unforgettable moment. Before I end my speech, I would like to give you my pantun. And all men will converse. We walk fast with curiousness. May the participant always be filled with happiness. Hopefully, this event will be successfulness. Wassalamualaikum warahmatullahi wabarakatuh. Good morning.
Thank you to Mr. Iwan Iskandar SKM MKM for the speech. Ladies and gentlemen, next we will have a keynote speech by the head of Minister of Health Department Riau Islands Province. To His Excellency Dr. Muhammad Bisri SKM MKes, the time is yours.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Peace upon you. Salam sejahtera untuk kita semua. Honorable Dr. Saiful Nizam bin Subari, family doctor in charge my health and medical center in Singapore. Also, the Honorable Mr. Sudirman bin Othman, Recruited News Singapore and Australia, founder of the clinical director holistic care, and also yang berhormat the Honorable Dr. Igusti Ngurah Edi Putra, our diaspora from UK. Maybe now about 1 or 2 o'clock in UK. Thank you. Our postdoctoral research associated Department of Psychology, University of Liverpool, Department of Institute of Population Health. Also, Mr. Miss Rahmadina MKep dari Polytechnic Ministry of Health Tanjungpinang, the head of midwifery department, and the Honorable Ibu Ramdina MKep and Miss Angelina. Also, all audience, all participants, the student, maybe from our all cross country, or Indonesia, maybe Pak Iwan invite all student Polytechnic. Also, in the first of all, I want to thank to Mr. Iwan as the director of Polytechnic Ministry of Health for this agenda, for his initiative to give to first international conference center of excellence ICCOE Health Polytechnic Ministry of Health Tanjungpinang. Maybe this is the first time to make international conference from Tanjungpinang, by Polytechnic Tanjungpinang. All audience, first of all, as the first step, we will focus on the main priority for the government of Riau Island Province, that is improving the level of public health. Actually, our governor, Mr. Ansar Ahmad, very concerned with the health for the community in Rio Island. One day, he always thought, the most recent, I go to governor candidate, Bill, it's because of the situation of our status health in our community in Rio Island. Because health is the very important for the prosperity, for the economic development in Rio Island. We know our COVID situation 2 years ago has affected our health status in general. We can see maternal mortality rate also rise, infant mortality rate also rise. But in the last year, 2002 and 2003, we reborn again. We breathe, we try hard how to decrease our level of mortality or infant mortality rate. Now, our infant mortality rate is about 76, below national level. But nowadays, there are still numbers mother as who have to face health risks and no optimal access of health service. Therefore, the government of Rio Island Province has taken strategic steps to reduce health risks by providing health services to the community in all stages of the life cycle. They are starting from pregnant and breastfeeding women, babies, toddlers, teenagers, productive age, and the elderly. To accelerate improvement in the community nutrition, we will focus on effort to accelerate the reduction of stunting through monitoring growth and development, and also improving environment quality. All audience, thanks God, by our synergy, collaborative, all sector, all stakeholders, the Rio Island Province able to reduce the maternal mortality rate and infant mortality rate under the national. Based on the data report of 2020 population census data, the maternal mortality rate of the island is in 2022 80 per 100,000 live birth, and the national MMR is 189. Meanwhile, the infant mortality rate, as mentioned before, 10 by 1,000 live birth. Meanwhile, for the stunting prevalent, based on the result 2022 Indonesian Nutrition Status Survey (SSCI), the Rio Island Province is the fourth lowest province in Indonesia, about 15.4%. 15.4%. I hope next year maybe we have achieved our target 14% stunting. Focus of under 5 children with stunting status. Our position is after Bali, Province, Jakarta, and Lampung. All audience, as the effort to improve the health status of mother and children, the government of your island has established several holistic integrated service posts. We call it posyandu, to improve our integrated primary care. Hopefully, this holistic integrated service post give impact to prepare the nation next generation, especially for stunting purposes. Currently, all regency cities and district in the Rio Island province are preparing to implement holistic integrated service posts. Posyandu. Nowadays, the total of holistic integrated service posts in Rio Island was 17 units. Totally, we have about 1,600. When we start this year to implement holistic integrated service posts by 17. Hopefully, in the future, this program can be implemented in all integrated service posts in Rio Island province. Again, in the line with increasing the level of public health, it's also necessary to implement clean and healthy living behavior in daily life. As a form of the healthy living community movement, the geography of the Rio Island give the positive and negative value in applying this program. As you mentioned, we have 7 districts, 7 districts, yeah. All districts spread by the sea. Yeah, we know we have a lot of problem about this geography. But surprisingly, from Ministry of Health, Central Ministry of Health, always say the achievement in health status in Rio Island is always good, despite of the situation, difficulty in geography and others. So we hope in the next years by collaboration, strong program, better management in provincial health office, district health office, also community health center, Puskesmas, by new integrated primary healthcare, also Posyandu. The collaboration of all these resources can deliver as better services for the communities. This audience, this movement is not only depend on government action, but also need participant from all elements of society in the Rio Island profession, including for all students in Polytechnic, Ministry of Health, Tanjungpinang. All of you, all students, you have to big thing. You have to have a big thing. You have to think big, think globally, and you have to start with local problems, our community problem. That we have a big dream to improve our community health status in the world. No, we are neighboring with Singapore, Malaysia, Vietnam. They have good Thailand. They had good health services for the people. Hopefully, this meeting again thank for Pak Iwan and the staff, Polytechnic Ministry of Health Tanjungpinang. This meeting will provide knowledge and open our mind together to unite our step, move forward to achieve the vision of the Rio Island province. Let's work together to create a healthier and sustainable future for the Rio Island. All audience, that's all my speech. By saying Bismillahirrahmanirrahim, I hereby declare the first International Conference Center of Excellence ICCOE Health Polytechnic Ministry of Health Tanjungpinang 2023 officially open. In the end, before I close, I want to deliver a poem, pantun, Indonesian language. Indonesian language. Bunga berkembang, bukan buatan. Cakep ya.
Lawa.
Harumnya asli berdaun lebat.
Flower.
Saya ucapkan selamat mengikuti kegiatan, semoga mendapatkan ilmu yang bermanfaat.
Lah, Pak Kadif Flower.
Thank you. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Salam.
Haji Ansar Ahmad. Thank you.
Thank you to Dr. Muhammad Bisri SKM MPes for the speech. Now, ladies and gentlemen, we will have a group photo session. Here it will divide it into two sessions, starting with group photo session in this hall and the screen capture from Zoom meeting of participants at home. For our first session, please to all related parties to take your places.
Nine o'clock ya. 9 ya. Kita uang. Session?
Yes.
With me? With me?
Thank you for the audience and all participants for the photo sessions. That was the opening of the ceremony, the first International Conference Center of Excellence Health, Polytechnic Ministry of Health Tanjungpinang 2023, Public Health on Islands. I, as the master ceremony, would like to apologize if there were mistakes in bringing today's event. And I end here by saying, wabillahi taufiq wal hidayah, wassalamualaikum warahmatullahi wabarakatuh. As we end our opening ceremony, now it will be continued to the next event that will be handed over to our moderator, Mr. Hendra.
Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Can I start with pantun? And I need everyone at home, in the office, and right here, you say lawa. Pakai tanja oleh Hang Jebat. Lawa. Digunakan oleh Raja Hendra. Seminar International Poltekkes Tanjungpinang dibuat.
Lawa.
Wah. Semoga jaya anak muridnya. I'm really excited to be here in these events anyway. First of all, a very good morning to everyone here, as well as participants behind the screen or laptop back home, virtually or online. The Honorable Mr. Ramsar Rahman, Governor of Kepri Province, or represented by Bapak Muhammad Bisri, SKM, Master Kesehatan. Mr. Iwan Iskandar, the Director of Tanjungpinang Polytechnic Health Ministry. Distinguished guests, lecturers, a potential student in Umrah Anugerah Bintan and Hang Tuah, prestigious speakers in abroad, especially in Singapore and in England. Ladies and gentlemen, welcome to our first International Conference Center of Excellence in 2023 in Tanjungpinang Health Polytechnics Minister of Health. Our first international seminar is called Public Health on Islands, is conducting in 2 languages, in English, in Bahasa Indonesia, of course, as well as in Malay, because we are in Kepri. By the way, I'm Raja Hendra, Raja Basirul, an executive English coach, English trainer, in-house training in Kepri since 2002 up to now. Alhamdulillah. Well, it is a pleasure to be moderator in this beautiful morning in this event for the next few hours ahead. This is a very great opportunity, I think, for all of us here to share the stage as well as webinar on this international seminar. Welcome to you, Dr. Saiful Nizam bin Subari, MBBS family doctor in charge, my health medical center in Singapore. Thank you very much, doctor, for being here. We would like also to congratulate to Dr. Saiful for your outstanding service award from President Tharman Shanmugaratnam lately on October 3rd, 2023 this year, for his service to the Red Cross and community in Singapore. Nah, beliau ini baru saja menerima, ya, lately barusan penghargaan dari Presiden elected yang baru sekarang ini, Mr. Tharman Shanmugaratnam, Singapura, yang memberikan penghargaan outstanding achievement pada pengabdian beliau itu di Singapore Red Cross, and still many more achievement that I can explain to you here. Again, thank you, sir, very much for being here online with us, doctor. And it is also a great pleasure and honor for us here in Kepri Province, with rich culture of nature, comfortable, cozy, and stunning islands. It is beautiful islands and heartbreaking to explore. We would like to welcome all participants here in this Poltekkes Tanjungpinang. This seminar is also conducted in hybrid setting. Therefore, we also would like to welcome those participants who are joining us virtually or online. We wish that you could join us in person here in Tanjungpinang Poltekkes, Kepri Province, probably next time. We are here today to share regarding the topic public health on islands, and we have an incredible list of speakers, 3 speakers from abroad, and presentation as well as located time Q&A, question and answer later on, which will, I believe, it will cover several intriguing, fascinating, and crucial issues. So, without further ado, it is my pleasure to introduce and call Dr. Saiful.
Thank you very much, Rajahendra, for that kind introduction. Can you hear me? Oh,
Yeah, we can hear you.
thank you so much. Yes.
My pleasure.
To the director, to the Governor of Riau, Haji Ansar Ahmad, to the director of the Health Polytechnic Ministry of Health Tanjungpinang, Mr. Iwan Iskandar, the Honorable, to the lecturers, students, all the online participants, wish everybody Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Firstly, I'd like to apologize for not being there. Thank you very much for inviting me to come and speak at the first international conference on health in the hinterlands and this center of excellence. And I'm really honored to be here to give a talk. To give a talk on this kebijakan or the health policies of in Singapore. So I think I shall start first, okay, and share my screen. And as I mentioned, I think I'll try my best to give this talk in dua bahasa. Saya akan berusaha untuk menyampaikan ceramah saya di dalam 2 bahasa. Mohon maaf kalau ada yang kurang ya. Okay, saya akan share my screen. Can you see my screen?
Yes, you can see that.
Okay. So, okay. Sekali lagi, thank you so much for inviting me. Yes, so a lot of things to cover. Okay, semasa saya dikasih topik ini, kebijakan pelayanan kesihatan masyarakat terkini atau the current public health service policy, saya rasa agak tinggi topik ini. Ya, jadi saya rasa akan memberikan sudut pandangan ya, and my perspectives from a family doctor in Singapore. So inshallah, and with Bismillahirrahmanirrahim, I shall start. Okay, so agenda kita pada hari ini ya, memberikan salam perkenalan, sedikit background atau latar belakang untuk kami di Singapura, sistem layanan kesihatan di sini atau Singapore Healthcare System, kesihatan masyarakat, pelayanan keluarga, pelayanan masyarakat, kesihatan keluarga, which translates to public health, primary care, community care, family care. So there is a lot of things to be done in this space, and of course, in the end, we shall have a summary atau kesimpulannya. Sedikit biografi, ini mungkin terlalu banyak ya, tapi sedikit aja saya akan menceritakan. Jadi saya sudah menjadi doktor semenjak 2001 ya. So I graduated from NUS in 2001. Meneruskan pelajarannya in bidang kesihatan pekerja atau occupational health. And 2013 I set up my clinic in West Coast. West Coast tu di bahagian barat daya Singapura. Di sini untuk istilah family doctor, ini sedikit beda ya dari doktor umum yang ada di sana. Jadi alhamdulillah saya sudah ke Indonesia dan melihat bagaimana keadaannya di sana. So for us in Singapore, a family doctor has extra skills, extra understanding, extra abilities to actually help the family. Yeah, so we have to look at the context. We have to look at how medical treatment is being given to the family from birth, okay, dari lahir sampai seorang patient sakit itu akan meninggal, ya. So saya memberikan pelayanan medis, my service to the family, keluarga, komunitas dan juga PT-PT yang ada di sini. Sedikit juga background saya mengenai ini, saya dulunya sering pergi ke Indonesia untuk bantu ya dalam misi penanggulangan bencana. So I was involved in a number of disaster relief missions, and terutama sekali pasca tsunami di Melabuh Aceh ya. Jadi itu pada waktu 2004-2005. Setelah itu saya juga pergi ke Pulau Nias untuk ada gempa di sana ya. 2006 saya telah terlibat di dalam satu misi penanggulangan bencana sebenarnya untuk misi Merapi. Waktu itu Merapi kayaknya mau meledak ya. So at that point of time, the volcano was about to erupt. Then I was there, and we experienced an earthquake. Kita merasa gempa bumi pada waktu di sana 6,4 Richter ya. So 6.4 on the Richter scale. Dan kami adalah salah satu tim medis yang pertama yang ada di lapangan. So it is very challenging situation ya. Ramai jiwa yang terkorban ya pada waktu itu. Juga saya telah menerima penghargaan dari Menteri Kesihatan Singapura waktu itu. Dan 2008 seterusnya oleh kerana tidak bisa keluar ataupun ini harus berada di Singapura. So I have to just organize things in Singapore. So number of missions, relief missions to Padang. Saya rasa 2008 ada di Padang earthquake ya ataupun gempa bumi di Padang. Bah ataupun floods ya di Malaysia dan juga di Rohingya ya. Banyak yang Muslim yang ada di sana. So in 2017, I was a board member of the Singapore Red Cross and also in charge of the Red Cross Club in Southwest. Itu jabatan Presiden Klub Palang Merah Barat di Singapura. So ini gambar saya. Alhamdulillah, saya baru terima anugerah. Just received this award from the newly elected President of Singapore, President Taman Shamagaratnam. And yes, alhamdulillah, it's been a long journey. Kalau dalam bidang ini saya rasa 17 tahun untuk misi penanggulangan bencana gitu. Juga di 2014, in 2014 to 2018, I was the General Secretary of the Association of Muslim Healthcare Professionals. So at that point of time, we helped the community to become better dengan visi rumah yang lebih sihat. Yeah, so alhamdulillah managed to increase the participation and the membership from 20 to more than 200 professional members. Currently, I am also part of this Healthier SG main working group, iaitu anggota kelompok kerja utama ya untuk Healthier SG. Ini satu program nasional yang baru dilancarkan di Singapura. Juga sebagai penasihat National GP Practitioner Advisory Panel di bawah Kementerian Kesihatan. Juga saya terlibat di dalam beberapa jawatan kuasa, parti jompo. Di sini ada beberapa NGO ataupun jadi Jamiah ini adalah satu NGO besar yang Muslim yang ada di sini. So Jamia itself is a large Muslim NGO in Singapore. Juga saya terlibat di dalam jawatan kuasa ataupun komiti untuk narkoba dan juga peninjau penyalahgunaan anti-inhalation atau anti-inhalant abuse di bawah Kementerian Dalam Negeri. Okay, so for the topic for today, jadi untuk memberikan sedikit latar belakang, background. Jadi kita tahu Singapura ini sebenarnya pulau yang kecil, dari satu tanjung ke satu tanjung itu 1 jam. So kita melihat di dalam pulau ini there's about 4 to 5 million residents. So this is the latest census. Iaitu jumlah jiwa penduduk yang ada di Singapura. So daripada 2010 yang sebelah kiri 5,08 miliar sampai 5,69 miliar. Saya rasa kalau di Kepri dan sebagainya tidak sampai lah Jadi bukan penduduk sekitar 3 sampai 4 miliar, bukan penduduk 1 miliar lebih, Jadi sistem kesihatan ini harus menjaga semuanya. Jadi kita sudah tahu, we know, di Singapura ramai masyarakatnya menjadi lanjut usia. A lot of the residents, and the people that are in Singapore have become older. So kalau kita lihat di gambar di sebelah kiri, 2010 sampai 2020, all the residents yang berusia 65 tahun ke atas itu sudah meningkat. Jadi kita tahu ini akan menjadi lebih banyak 2030, 2040. Jadi bagaimana kita menghadapi waktu penuaan ataupun when you have healthy longevity, how do we take care of our residents here? So di sebelah kanan adalah distribusi ethnics ataupun the racial distribution, and it is actually a multi-ethnic society. Iaitu di Singapura ada orang Cina, Melayu, India dan sebagainya. Satu istilah yang menarik iaitu adalah bagi orang Melayu di sini, itu istilah yang merangkumi semua orang dalam Nusantara. Jadi sebagai contoh, saya Jawa, kalau KTP saya Jawa, generasinya dulunya dari Jawa. Tapi kalau di Singapura saya sudah masuk Melayu, jadi saya lebih cenderung kepada kebudayaan Melayu. So this is just one example. So istilah Melayu ini merangkumi semua orang di Nusantara seperti Bugis, Minang, Banjar dan sebagainya. Okay, so we come to the part about the Singapore's healthcare system. So you can see that on the left side of the screen kita ada kesihatan yang umum, primary care. So primary care ni adalah sesuatu yang di lapangan, dan ia terdiri dari puskesmas, doktor umum, doktor keluarga dan juga pusat kesihatan masyarakat. So on the left side is primary care. So primary care is front line. So we are in a community and we feel the community. So how then can we increase the quality of our care? So that's one on the left side, and then on the right side is to the hospital. So dari hospital ada beberapa. So you have hospital umum. Of course, specialized hospital. You have specialist centers. To treat, for example, like cancers, heart disease, eye problems, skin, neuroscience, and dental issues. Issue mengenai gigi, and also, of course, community hospitals. So it's a spectrum. Sesuatu yang daripada lapangan sampai ke rumah sakit. Ya, so kita bisa melihat ya daripada rumah sakit itu, kalau kita kembali kepada masyarakat, apakah yang ada ya. Jadi kita harus bentangkan dulu ya, what is the background, what is the healthcare, okay, and where is everybody, okay, in this space. Jadi dari segi sebelah kiri kita melihat ada pelayanan yang berpusat, iaitu center based services. Kita ada pusat pencegahan hari. So dari sini ada pusat-pusat di mana kita bisa kayak menitip ya, ataupun we can put the elderly, okay, orang yang warga emas di tempat yang bisa dijaga ya. Kita juga ada pusat kegiatan senior, iaitu bagi warga emas untuk memberikan mereka kegiatan ya, okay, seharian. Kerana kalau sudah tidak bekerja dan sebagainya, apakah yang harus dibuat bagi mereka? Seterusnya adalah pusat rehabilitasi komunitas. Jadi bagi mereka yang terkena penyakit, apakah yang harus, bagaimana mereka bisa dirawat? So for a lot of them, if they have certain diseases, they may not need to have a full hospital service. So then how do we have community centers that can help to improve their health, improve their and to undergo rehabilitation? Kita juga ada ini rawat inap komunitas. Jadi ada community hospital, we also have nursing homes, panti jompo, juga pusat rawat inap paliatif. Paliatif ini sesuatu konsep yang interesting kerana ia melihat di dalam bidang, di dalam bagi mereka yang ada penyakit yang sudah parah, bagaimana kita bisa meringankan ya sesuatu atau perkara yang penderitaan mereka. Yeah? How can we make them comfortable in the end of life? Yes. Dan kita sudah tahu bahawasanya pelayanan medis itu sudah sampai di rumah. Ya, jadi pelayanan di rumah, bagaimana kita merawat di rumah, terapi di rumah, dan ada juga rawatan paliatif, ya, yaitu di akhir hayat. Ya. So we do have home-based care, which involves home nursing, home therapy, and of course hospice home care. Okay, so di Singapura ada dua ya, so kesihatan publik dan kesihatan yang swasta ya. So dari segi yang publik, yang background yang kuning ini, kita ada 10 rumah sakit umum, 1 rumah sakit kebajikan, dan 8 rumah sakit swasta. Jadi tidak sebanyak yang ada di Indonesia lah ya. Dan kita bisa lihat di sini ada nama-namanya, nama-nama tempat institusi, all the various institutions, healthcare institutions that have the rumah sakit and all the things that are around them. Okay, so it's not in silo. They do not work in silo. They have to work with the community partners that's around them. So gambar ini menunjukkan pelayanan kesihatan umum. Ya, di sebelah kiri adalah klinik saya, My Health Medical Center. Di sebelah kanan itu adalah puskesmas ya. Ya, so Clementi Polyclinic ini yang puskesmas pusat kesihatan masyarakat yang terdekat. Kalau di Singapura, we have about 1,800 klinik swasta atau general practice, 23 puskesmas poliklinik, lebih dari 200 klinik gigi, lebih dari 300 farmasi atau apotek atau kedai obat lah. Okay. Busy slide, there's a lot of things here, tapi Kementerian Singapura sudah menjalani, okay, bagaimana untuk mentransformasi atau how do we change, ya, bagaimana kita bisa berubah healthcare ya yang ada di Singapura, pelayanan medis yang ada di Singapura. Jadi visi yang pertama itu adalah memperjuangkan bangsa yang sihat bersama rakyat, untuk hidup dengan baik, berumur panjang dan fikiran yang tenang. Saya rasa ini memang sesuatu yang tinggi aspirasinya. It is very challenging, tapi setiap perkara yang sulit itu pasti insyaAllah akan ada baiknya ya. So bagaimana untuk mendapati ini? Ya, jadi dari pelayanan kesihatan kepada sihat. Jadi beyond healthcare, so istilah ini adalah bagi kita di bidang medis, it is very reactive. Maksudnya ia selalu bereaksi ya kepada sesuatu. Ada orang sakit, baru kita tindakan. Tapi bagaimana untuk membuatnya lebih ya? Bagaimana kita semua bisa sihat dan mencegah dari dari sakit, itu yang pertama ya. Jadi waktu Singapura itu menjadi merdeka ya, jadi waktu itu sangat singkat ya, so it was about 60-70 years. So a lot of focus adalah kepada rumah sakit, bagaimana untuk meningkatkan kualitasnya. Sekarang bagaimana untuk meningkatkan kualitas standar pelayanan kesihatan dan medis untuk kepada masyarakat yang umum. Jadi sudah mencapai kualitasnya, sekarang bagaimana kita memberikan nilai ya, beyond quality to value. Okay, so apakah sebenarnya istilah-istilah ini dan bagaimana ia bisa dirincikan kepada perkara di lapangan. So a few enablers adalah sesuatu yang perlu digunakan untuk sampai kepada visi-misi kita. Paling fokus pada pekerjaan dan keterampilan ataupun skills ya. Ya, semua tindakan itu harus berkualitas dan mengerti dan faham. Ya. Productivity, kerja yang lebih baik, kerja lebih cerdas ya. Jadi work better and work smarter. Inovasi, bagaimana kita bisa melihat di lapangan ataupun di mana aja lah sebenarnya, di lapisan mana aja, how can we make things better, okay, and that's through innovation and all that. So akhirnya kesimpulannya adalah keterampilan yang lebih baik, kerja yang lebih baik, perawatan yang lebih baik, iaitu tindakan dan quality of care harusnya lebih baik. Jadi kita bisa melihat ya dari segi transformasinya, harus ada aspirasi ya, iaitu vision. Dari situ itu akan dilihat ya apa yang diperlukan ya. Jadi untuk memberitahu kebijakan ini banyak ya, jadi agak sulit lah kalau saya mau bentangkannya dalam 1 jam ya. Tapi saya akan mengambil sedikit ya, a bit of snapshots here and there. Jadi sebagai contoh, Jabatan Kuasa Pengadaan Kementerian Kesihatan telah membuat satu skim nasional, iaitu bagaimana kita bisa memperkasa kehidupan yang sihat. So ada satu konsep ini, the name is called Healthier SG. Ini adalah satu cara bagaimana bukan reaktif tapi preventif ya. Secara okay, it is very hard. It is a very hard thing. If you imagine our community, bagaimana kita bisa menasihatkan keluarga kita, how do you advise our parents, our brothers, sisters, you know, how can they become healthier and all that stuff. It is actually quite challenging. But Singapore's healthcare system, with this new national initiative, is now changing towards a preventive healthcare model, which to me, bagi saya, ia mungkin akan berhasil bukan besok, bukan 1 bulan, 2 bulan, tapi mungkin 10-20 tahun yang ke depan. Ya. So, ia itu satu inisiatif nasional, langkah proaktif bagi warga negara di sini untuk mengelola kesihatan mereka, prevention of chronic disease, dan bagaimana kita mendukung kuat untuk menjalani gaya hidup yang lebih sihat. So program ini satu program yang besar lah ya. Ia merangkumi semua kebanyakan doktor keluarga yang ada di Singapura. So Healthcare SG, what is strategy? Di sini ada jaringan ya, network of family physicians, care plan. So semua orang harus ada perancangan kesihatan. Tapi masalahnya bagaimana untuk memastikan ya mereka akan menjalani tindakan itu. Seperti contoh, kalau kita menasihatkan, okay Pak, jangan makan daging sapi, gitu, ya. So how do we ensure that that happen? Okay, turunkan kadar kolesterolnya gitu. How do we measure that? How do we ensure how much proportion of food? Okay. Dan kita bisa lihat community partnership, ya, bagaimana ia merangkumi semua yang ada di dalam sekitaran. Bidang kesihatan ini bukan sendiri ya, tapi ada yang lain, ada kerja, ada organisasi kebajikan, ada pasti banyak organisasi-organisasi yang lain. Ya. Jadi sekarang this concept of enrollment, satu patient, satu doktor. Ya. Jadi ini harus disupport bagaimana ia bisa berlaku. And untuk support this thing, untuk menyokong perkara ini, bagaimana dengan manpower, kewangan, IT dan data. Jadi akhirnya ia menyokong ya rawatan dari doktor keluarga. So doktor keluarga ini mungkin satu doktor untuk satu hayat lah, itu yang aspirasinya. Dan mendukung secara menyeluruh ya, and supporting the healthier lifestyle and to have better health outcomes. Dan bagaimana kita bisa membantu pasien pesakit untuk bertanggungjawab atas kesihatan diri sendiri. Okey, banyak sangat, banyak points-pointsnya. Okey, tapi ini adalah feature Healthcare SG di mana satu pilihan ya, kalau kita melihat nombor satu, memilih untuk hidup yang lebih sihat. Okay, bagaimana kita bisa menyokong itu. Kedua, ya, iaitu strong patient-doctor relationship. Bagaimana kita bisa menyokong, okay, doktor dengan pasiennya, pertalanannya, perhubungannya. Ya, itu satu. Kalau saya merangkumi istilah ini, mungkin bagaimana kita juga untuk bantu istilah patient dengan tenaga medis, iaitu even with the nurse. How do you help that? How do you help dengan bidan? Bagaimana kita bisa menguatkan ya perkara ini? Dan seperti saya katakan, shiftnya daripada reaktif kepada preventif. Ya, so it's a very big movement for us in Singapore. Jadi bagaimana kita akan membuatnya? Screening itu untuk melihat apakah yang diperlukan, apa yang seperti kolesterol, diabetes, dan juga tensi ya, hipertensi, dan juga vaksinasi. Jadi di sini kita memastikan semua orang itu memerlukan dan mendapatkan vaksinasi yang diperlukan. Support from the community, bagaimana masyarakat kita mendukung dari segi olahraga, dari segi badan-badan olahraga, dan yang sebagainya. Ya. Dan bagaimana kita bisa melayankan atau memberikan perawatan yang lebih baik, IT infrastruktur, data dan sebagainya harus ada. Ya. Jadi kita tahu di sini banyak penggunaan alat-alat digital ataupun digital tools. Ya. So di video mungkin pihak panitia bisa mainkan grafasi kebagusan di sini. Okay, nah, let me try this. Bisa mendengar?
Your voice belum boleh dengar.
Bisa dengar?
Not yet.
Oh yeah, I think you may have to play it over there. After this happens.
Oh, can you share the sound?
So saya akan cuba ini mainkan video sedikit. Able to play?
No, no voice.
Yeah. So this sometimes happens. Yeah.
Take it easy.
Yeah, you may have to play the video on your side. Yeah.
Voice.
Voice no? Ah?
No voice.
Okay. Boleh baca di bawah je gitu. Cari katanya.
Okay. Click something more. Set up because I want to. First, I start to help you managing and monitoring healthcare issues. Change with this and trust, build, and with close monitoring. Is not the core for something that I love the most. It's something that fun. Right, thank you, Doctor.
Okay, sorry. Yeah. So maybe you can share the link later. Huh?
Yeah, we will. We will.
Okay, so tadi video tadi itu menunjukkan ya. Okay, sorry. Ya. So video ini ya menunjukkan ya ini praktik saya dan bagaimana kita melayani pasien dan sebagainya itu. So actually how to support the doctor-patient relationship. So kebijakan yang seterusnya ya healthcare clusters. So di Singapura ada 3 healthcare cluster di sebelah kiri NUHS, tengah dan juga di timur ya. Jadi mereka akan mendukung kita semua. Juga untuk melihat bagaimana untuk jadi dari segi pihak Kementerian Kesihatan untuk mengurangkan rokok, kurangkan konsumsi gula, bagaimana untuk kurangkan pemakanan ataupun ini konsumsi garam ya. So of course strengthening the healthy mother, healthy child. Okay, I think your governor in your opening speech also mentioned about this also. So this is something that I think is very important topic in Indonesia because I think you have a very high birth rate, and then for us in Singapore we have family nexus sites or pusat keluarga. Yeah, so happy mother, happy child. So bagaimana untuk bersama untuk ini, and more support for high risk women. Yeah. So supporting mother able child, so there's some of these things, and parent hub untuk bagi ibu bapa ya. Yeah. One stop parenting resource portal to support pregnancy and parenting. So so there are many of course other aspects. So banyak lagi kebijakannya seperti yang kepada senior, apa yang harus dibuat bagi mereka yang keluarga dengan perempuan seperti ini. Lower income bagi mereka yang kurang mampu, bagaimana kita bisa bantu mereka, okay, untuk suku etnis ataupun kaum Melayu dan India, kolaborasi, okay, dan juga Healthy SG, Healthy Singapore Fund. Di sini juga kita pun ada skim kayak BPJS ya. Jadi bagaimana ia bisa menampung dan support ya. Bagi mereka yang mungkin kurang mampu ya. Jadi di sini bagi mereka yang ada kartu ini, mereka dapat dibantu oleh kementerian sini. So IT and innovation support, okay, bagaimana untuk mendukung ini semua dengan IT dan transformasi. Jadi banyak sangat perkara yang harus dibuat dan data sharing, clinic management systems, electronic medical records. How do we do that? So invest in IT infrastructure to help prove our healthcare system. Okay, so we have all these new polyclinics being opened up. 022, 023. Okay. So dari sudut pandangan saya, okay. Waktu dulunya masyarakat Singapura ini masih muda ya, okay. Jadi dia menempuh pada penubuhan pelayanan medis yang baik, ya. So tertiary care iaitu di rumah sakit. Sekarang kerana masyarakat Singapura menua, bagaimana kita bisa menumpukan perhatian untuk mencegah penguatan rawat inap. Jadi sekarang we are overloaded. Sometimes we are overloaded. Our hospital system has many patients, and then how can we reduce that? So the answer has to lie somewhere in the primary care ataupun in the community. Bagi sudut pandangan saya itu bagaimana menggunakan sistem IT. IT ini satu, tapi IoT, Internet of Things, sebenarnya how do we use the things that around us, okay, untuk membantu pelayanan medis. So over here, NEHR is a National Electronic Health Record, iaitu satu rakaman di satu sistem nasional di mana semua data ada di sana. So NEHR is also a very important thing which gives us a backbone ataupun menyokong kita semua, kerana kalau seorang patient rawat di satu poliklinik, di praktek ini, di rumah sakit, bagaimana semua informasi itu dapat bersama. Ya. Jadi IT system itu harus diadakan dan ia juga merakamkan sistem vaksin negara, pemeriksaan kesihatan dan juga meningkatkan mutu doktor umum kepada doktor keluarga. Yeah, how can we increase that quality? And kalau semua orang itu sendirian, itu pasti nggak tahu kan, mereka tidak tahu apakah yang berlaku di sekitar. Tapi kalau kita kumpul mereka, mereka akan berbincang bagaimana untuk meningkatkan statusnya atau standarnya dan sebagainya. Ya. So ini satu sudut pandangan dari segi saya sebagai doktor keluarga di lapangan. Jadi kesimpulannya adalah kebijakan kesihatan memang kompleks ya. Ya, jadi bukan gampang, bukan senang untuk memberitahunya. Tapi pasti semuanya harus ditukar atau harus di-translate kepada sesuatu yang bisa digunakan di lapangan. Itu caranya, itu soalan yang selalu kita menghadapi sebagai orang lapangan. Akhirnya bagaimana untuk mendukung kepercayaan seorang pasien itu kepada dokternya, kerana dokternya itu ada pokoknya ada maklumat informasi peribadi semuanya yang mungkin lebih ya daripada kadang-kadang ahli keluarga. So how do we support that? Dan saya rasa juga tenaga medis ataupun all the people that are involved in healthcare, how can we support them? So I think with that, I end my presentation. I think we have some time for Q&A. Please, if there's any questions, you can ask me at this stage. Thank you.
Dr. Saiful, let's come to the Q&A session from participants, students. Perhaps I may start from my question. Is that all right, Doctor?
Yeah, sure. Yeah.
Dengan saya memberi pertanyaan saya. Right. You've been around in Indonesia. It looks like you've been around in Indonesia. Sepertinya Dr. Saiful sudah familiar dengan keadaan kesehatan di Singapura. My questions is, what are the difference between health system in Indonesia, my country, and Singapore, and then how do you think we can improve our healthcare system, especially in Indonesia? Jadi bagaimana menurut Dr. Saiful perbedaan kesehatan sistem health system yang ada di Indonesia dan di Singapura, because Dr. Saiful sering dia sudah melala buana di Indonesia, so I believe kita yakin dia paham, dia understand. Lalu the biggest question ini bagaimana kami di Indonesia improve lagi, memperbaguskan lagi sistem kesehatan. Thank you, Doctor.
Okay, thank you very much for that question. That's a very big question. Two big questions, yeah. So to answer that, I think every system has got good and challenges. Okay, semua sistem pasti akan ada baiknya, ada masalahnya, cabarannya semua. Ini satu soalan yang rumit, tapi kalau saya lihat dari segi lapangan itu, sekarang dunia dah berubah banyak ya. Jadi bagaimana kita gunakan? How can we use technology to bypass? How can we leapfrog? Maksudnya ada negara-negara sebagai contoh ya di Afrika, mereka menggunakan sistem pengantaran darah, menggunakan drone. Rwanda is using that. So very interesting system. Dan saya rasa semua sistem kesihatan itu berbeza-beza ya. So semua berbeza-beza. So kita pasti melihat bagaimana penyampaian medis, itu bisa ditingkatkan kualitasnya dan dihaluskan teknis-teknisnya. Saya rasa itu yang dari sudut pandangan lapangan lah ya. Of course dari segi healthcare policy, I'm not in the sense public health, tapi harus menaikkan infrastruktur yang bisa mendukung. Saya rasa itu yang menjadi cabaran ya, yang saya rasa di semua tempat lah.
Thank you, Dr. Saiful. Mungkin dari partisipan di ruangan ada pertanyaan? Ya, from Bapak Pak Norfens, ya, Pak Norfens. Pak Harfen, bisa di unmute.
Thank you, Mr. Hendra.
Thank you.
Mr. Dr. Saiful, so nice to meet you in, what can I say, dunia maya gitu.
Online.
Also, you are from Java. What I want to ask about our family doctor is, Indonesia has also program Indonesia Sehat dengan pendekatan keluarga, or Indonesian program with a family approach. And Indonesia has also family doctor since perhaps 20 or 30 years ago. But in comparing to Singapore, Indonesia has a lot of territory from west to east. It differs with Singapore, with small, what can I say, small nations. So with family doctor in Singapore is more effective, but it's in Indonesia, family doctor is effective is only in cities. but in villages, it is not less effectiveness. So, how do you direct us to use family doctor, to apply a family doctor in Indonesia? Because in Indonesia, we are still lack of health professional, health facilities, and others like that. That's all I want to ask. Thank you very much, Mr.
Okay, thank you very much for your question. So just to sum up the question, I mentioned that in Indonesia, there's also family doctors, and the concept is been about 20, 30 years ago, and it's present in the cities mainly. I think this is a challenge for any developing nation is the concepts of family medicine. How can we improve, right, the quality of all the doctors that's in the nation, and so there are certain standards that has to be met, and the question is how can we give the standards to everybody, and we know. So even in Singapore, the management of different diseases, for example, let's say hypertension, diabetes, itself has got its own standards. So all the doctors come together, they say, okay, these are the standards. Okay, you need to do your blood pressure control at least twice a year. You should do your cholesterol checks at least once a year. For diabetes, your HbA1c, HbA1c ya, itu semua harus dibuat dan sebagainya. So standarnya ada gitu. So isunya setelah disetujui, bagaimana bisa diterapkan, ya, bagaimana untuk menerapkannya. So prosesnya untuk diterapkan pada semua dokter ataupun to all the doctors in the nation, I think it's challenging because dia ada umum, ada swasta, right? So that's the thing. The issue is how then do we gel this together, the private-public collaboration per se. So for us in Singapore, we have a public, and my clinic is a private. But because we come together, so there's all these discussions and negotiations and all that stuff. So it's something that is going to be very challenging. There's no perfect solution. But as long as we all know that we want to improve the health, and it has to start from there first, right? So and then looking at all the different indices, that are affecting, I think the community. I think with that, and how does it translate to the actions items on the ground? I think for us in Singapore, we have an advantage that because we are small, we are able to be senang dipagari lah. Okay, so perkara yang dibuat tu bisa gampang dilakukan atau it's easy for us to carry on, some of these things. Terus yalah, undang-undang di sini dan sebagainya, itu semua orang ikut peraturan dan sebagainya. Jadi kompleks dan susah, tapi udah ada contohnya, okay? And we've shown that one small island actually we can achieve a lot of things. Yeah.
Baik, bagaimana Bapak Harpen?
Thank you very much, Mr. Saiful. Up to now, Indonesian government has a program to distribute health professional. We can call it Nusantara Sehat as efforts to be placement of health professional around Indonesia. So it perhaps it's one of way to give healthcare services. Thank you very much. See you on another event.
Thank you for your comments.
Gimana? Ada lagi partisipan yang berikutnya dari peserta? Oh, dari student, Dr. Dari student. Dipersilakan.
Okay, thank you, moderator. Let me introduce myself. My name is Nurul Faiza. I'm from nursing class. I want to asking to Dr. Saiful Nizam. My question is, based on the text that I ever read, the most common cause of death in Singapore is cancer. What is the innovation that Singapore government have done to maintain the health issue in Singapore, especially in this case?
Okay.
Thank you.
Thank you very much for your question. So, yes, Singapore has developed such that cancer is now the leading causes of death. So we have lung cancer, we have things like intestinal or colon cancer. Colon cancer is actually one of the number one. So over here in Singapore, there's a national recommendation, okay, to do FIT kit testing, fecal immunofluorescence testing, which is actually untuk menguji najis untuk darah ya. So bagi mereka yang usia 50 tahun ke atas. So you know that cancer there are many, okay, banyak kanker. So which one do you focus at? You focus at the most common ones. So let's talk about colorectal cancer, okay, kanker usus besar ya. So then we have to look at what are the various screening tests that we can do. So as I mentioned, the health ministry here has recommended that we do fit kit testing for people above 50, and then we try to. So for all of us in primary practice di dokter keluarga, kita harus screen. Okay, semua orang usia 50 tahun sudah buat belum? Ya, kalau belum buat kenapa? So those are the things that we try and push for. So this is just one. So for females, for example, there are there's mammogram, breast cancer, cervical cancer. So those are things that we encourage, and there are certain guidelines to all of that. And the health policy, because it's already stated, then the money then translates down. Okay, we encourage people to do this, the kind of thing. We have free mammograms, or we have subsidized mammograms. We have subsidized, Pap smears, and these are things that if you have a CHAS card, okay, over here, which is like a BPJS di sana, then you can get some of them, with a very reduced price. Seperti $5, ya, $5, ya, 50,000, ya, mungkin di sana, ya. So these are some of the things that you have to look at. Okay, what is the most commonest cancer there? Example, let's say lung cancer, then should you do an X-ray? So what is the costings involved in doing the X-ray and all that stuff? And if you were to give to ask everybody to do X-ray, so those are things. So for now, lung cancer, we don't really do a chest X-ray yet. But if it goes up, maybe the government will recommend to do all of these things. Yeah. So frequent screening at certain age, and with evidence, meaning what is the evidence that supports this kebijakan and this tindakan.
Thank you, Dr. Saiful. How is it?
Okay, thank you, Dr. Saiful, for your great answer.
Come to the few more participants to ask the questions, Doctor. Would it be all right? Before 10 local time. Ada lagi beberapa pertanyaan sebelum kita ending session ini, sampai probably 10 menit lagi ini. Apakah ada pertanyaan mungkin dari partisipan yang di rumah, behind the laptop? No? Ada yang raise hand di sini? Oh, mungkin dari ruang? Okay, go ahead. Dari student, Doctor. Student.
Hello, Mr. Saiful.
My name is Hengki Rawat. I am the nursing program study. I will ask for you. I've read some article about health issue in Singapore. It said that Singapore has got incident of chronic disease. How is the efforts of the health and healthcare improvements in Singapore to fix this problem, especially with rapidly aging population? It will become more risky. Thank you, Mr. Seifa.
Okay. Thank you very much for the question. So to summarize the question again, you were asking about increasing amount of chronic diseases in Singapore, right? And then about the aging population. So this is a very good question, and we start with whatever we have. Okay, so we know that, as I mentioned in my earlier slides, that the population of Singapore is aging, and it's aging rapidly. So 2030, about 1 in 4 Singaporeans is over 60. You know, so it's like Japan. It's going to be like Japan. And the challenge is then how then with all this disease burden, the problem of all this chronic disease, right? How then can you do something about it? So of course, having good healthcare itself is important, but preventing that and slowing down the progress. So if the graph goes like that, right? But it should be slower, maybe, you know. So I think that's the intention of the healthcare policy here, is to try and reduce or cut down or even prevent some of these things from happening, which there are many factors, I'm sure you know. Like our lifestyle, lack of exercise, the food, the wonderful food, yeah. That's always a problem in Singapore, and I'm sure in Indonesia also. Yeah.
Okay, there.
Okay, thank you, Mr. Seifa.
Maybe we have one more question, Doctor, from lecturer. Yeah, okay, we have this from Ibu Safra.
Assalamualaikum warahmatullahi wabarakatuh. My name is Safra, and I would like to ask about, from your perspective, what would be the best health policy for a region like Kepulauan Riau? We have more than 2,000 islands, and how to make sure that everyone have equal healthcare? Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. It's a very good question. I think we start with your geography first, right? So there are multiple islands, and I'm sure you don't have enough. I don't think anybody will have enough medical professionals, healthcare professionals. The question then is, how then do you use whatever people are using? So I think IT itself, IoT, Internet of Things, and the internet. I think you have to see what the community or masyarakat is using. I think people use WA, right? I think WhatsApp a lot. So I think that is teleconsultation, telemedicine, and video consultation. I think it's something that we are adopting here very much in Singapore. So it's very easy to see a doctor, to see a nurse, be online, and to see and to check in with the patient to see how it is. The other thing is also to invest in perhaps may not be trained providers, may not be medical people, but maybe there are people on the islands that are a bit more trained. Then they can actually liaise with you to actually make sure that things are happening. Or you can, because the person is on the island, it's very hard for the boat to go to, right? So you have somebody who's there who's maybe that you have to train, because the person is staying on the island. I mean, can be like macam bomo lah, not bomo, but could be maybe somebody who's there young, or dihormati atau respected kind of thing, who may have can take in the extra knowledge about healthcare, and then can connect with you, so it can be your arms and legs on the ground. Yeah, that's just my point of view.
Okay, thank you. Memang itu suatu challenging sih, Bu. Maybe ada satu lagi pertanyaan, Dokter, from participant di behind the laptop. Ya, mungkin ada one more question dari teman-teman partisipan yang di rumah online. Jika tidak,
Excuse me, sir. I want to ask for Mr. Saiful Nizam.
okay, we have one more. Itu Pak Adil Chandra.
Okay, thank you, sir.
Right.
For Dr. Saiful Nizam, my name is Adil Chandra. I'm lecturer of health polytechnic Tanjungpinang and also chairman in Nurse Island province. I asked for you about service for elderly. Your presentation about in Singapore very much elderly. Indonesia also very much elderly. What about the family support in Singapore for service and elderly, and what the support government for elderly? Because I am still study from doctoral nursing in University Indonesia about my subject topic about supporting for elderly to uh, treatment hypertension. Thank you, Mr. Saiful.
Okay, thank you very much, Mr. Adi. That's a very good question, definitely. No easy solution. I think we all know that as we all age, there are a lot of problems, and we know that they become disabled or they are impaired in terms of their activities of daily living. So once you start to slow down, okay, then how can we support those things, right? Then the challenge is then how can we wrap around? So it depends on the concept, I think. So over here we have what we call aging in place. How
Yes.
can the person age in place in the house, right? And then have all the services either come to the person or the person goes to somewhere nearby, you know. So over here we have things like daycare centers, we have things like services that's in home base. We have nurses that can go to the homes, doctors to home. If the elderly, they can understand, the problem is that they may not be digitally literate. They may not understand about IT. Even using, maybe they can use VR video, maybe. Then maybe they can be helpful. But so what is the things that is easiest for them to use, you know, and it's easy for you to get. So like for us over here, if the elderly can use the WhatsApp video, we just use a clinic phone, and then we just make a phone call, and that's very easy but a lot of people, they want to see the doctors, they want to come face to face because they're not used to the teleconsultation. So I think to understand your population, to look at what their health seeking behavior is, what is their preference, and then to try and fit that. It is going to be challenging. As I mentioned, no easy solution, but we have a number of health policies that are in place to support aging in place.
Okay. One question more, Mr. Moderate. One question.
Yeah, sure, doctor.
Okay. Mr. Saiful, your presentation is very good about in Singapore there are two area, community and clinic. Indonesia also community and clinic. What I ask for you because in Indonesia community health center, puskesmas, polyclinic, but in Singapore there are community, there are hospital. What different Indonesia and Singapore? Thank you.
So the advantage in Singapore is very small. Okay, the padat, yeah. So gampang, so it's very easy to go anywhere. The challenge I think in Indonesia is very far. The distance, kalau di sana 2-3 jam itu dekat ya.
Yes.
Over here 30 minit dah jauh. So so it's different perspective. So for us, the healthcare system is very flat. It's very easy to move around. So I think the challenge for your side is then how can you traverse? How can you jump and make use of IT? That's how I find. The problem is that jaringan, you know, the network may not be so good, and you may not have the equipment. So maybe posyandu di mana-mana, posyandu di rumah. So bagaimana untuk dapatkan konsep itu? So it is challenging. setiap desa harus ada posyandu atau ni. So can you do that? Can that be done? So is something that maybe one concept, right, is that because it's very far, your desa-desa, right, is very far, then you have some maybe not posyandu but maybe orang tenaga medis ataupun orang yang tinggal di sana yang mungkin tahu dan bisa komunikasi. So that's one way. I think there are different models like this, I think in many developing countries also like that, yeah, to traverse the long distance.
Okay, thank you.
How's it, Pak Adil Chandra?
Okay, thank you very much. You asked what's my question. I want to pantun for Saiful Nizam, all right? Okay. Iya, oke. Bunga selasih di atas batu, enak dimakan di kampung kolam. Terima kasih and thank you for Saiful Nizam. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Right, 5 minutes to the end of this presentation session. Dr. Saiful, before we let you go, can we have another five minutes to have some kind of screenshot, and the committee would like to issuing you thank you certification.
Sure. Before we end, I also want to have satu pantun juga.
Okay, good.
Yes.
Everyone say lawa back home.
Yeah.
Please.
Please, Mr. Sarul Nizam.
Okay. Ya, insyaAllah ya. So, kerjaya kesihatan, kerjaya yang murni.
Lawa.
Pasti banyak rintangan didugai.
Lawa.
Anak muda harapan Kepri.
Lawa.
Pasti akan bisa berjaya nanti.
Yes. Thank you, Mr. Saiful.
For everyone and the participants back at home, online, hopefully we may organize this prestigious conference or seminars again in the very close future. I'm Raja Hendra, in-house training coach in Kepri. We would like to dismiss ourselves, and again, on behalf of my teams, we would like to say a big thank you to Dr. Saiful for your time. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you again.
As well as back home.
Thank you again for inviting me. Thank you.
See you again, Mr. Saiful.
Inshallah.
Okay.
Yes.
Yeah, thank you.
Maybe we come for the 5-minute break. Sebelum lanjut ke sesi yang berikutnya. Or let me just try to contact Pak Sudirman Sekretariat. Sudirman. Yes, we should have a 5-minute break. 5-minute break.
Yes, I know lagi. Teruskan aja. Lanjutan tadi aja. Lanjutan tadi aja. Aduh deh. Mana buka lagi lah berarti. Buka lagi. Gimana?
5 minutes break. 5-minute break. Can you check Pak Sudirman?
Masa depan negara tidak hanya berpangku pada pendidikan yang baik, tetapi juga ditentukan oleh kesehatan yang baik. Masih banyak wilayah negeri ini belum tersentuh oleh layanan kesehatan. Untuk itu, Poltekkes Kemenkes Tanjungpinang
sebagai pencetak calon tenaga kesehatan yang harus memulai itu dalam membantu penyerapan tenaga kerja kesehatan yang semakin tinggi permintaannya. Pulau Bintan adalah tempat yang indah yang menjadi destinasi wisata dunia, dan Tanjungpinang adalah sebuah kota bersejarah yang pernah menjadi pusat peradaban kebudayaan lain. Ibu kota provinsi Kepulauan Riau juga dikenal karena keramahannya, kemajemukannya, dan kebudayaan, termasuk di antaranya sektor kesehatan.
Kondisi geografis kepulauan menuntut ketersediaan tenaga kesehatan yang tidak saja banyak jumlahnya, tapi juga berkualitas sumber daya manusianya. Politeknik Kesehatan Kemenkes Tanjungpinang sebagai kampus negeri pertama di Kepulauan Riau hadir dan mengambil peran dalam memastikan ketersediaan tenaga kesehatan. Didirikan pada tanggal 27 September 2011, kampus ini sudah mencetak ribuan alumni yang telah tersebar di seluruh penjuru negeri. Kami bertekad memberi ruang serta kesempatan yang sama bagi siapa saja untuk berpartisipasi dalam mewujudkan visi menjadikan perguruan tinggi bidang kesehatan yang bermutu, berdaya saing, dan berintegritas di tingkat nasional tahun 2024.
Baik, Bismillahirrahmanirrahim. Let's coming back to another session. Second speakers. I do believe Sudirman, head of nurse, sudah sana. Okay, here we go. Bismillahirrahmanirrahim. Good morning and welcome back. This is another great opportunity to have you, sir, all of us, and to share the stage as well as a webinar. Me as a co-moderator in this international seminar. Again, I'm Hendra, Raja Hendra, an executive English coach in-house training in Capri. Welcome to you, sir, Pak Sudirman. So, Mr. Sudirman is a registered nurse in Singapore as well as in Australia, and he has worked for various healthcare institutions in both countries. He's also the founder and clinical director for Holistic Health Private Limited, which is health management and mobile nursing service with branches in Singapore, as well as in Jakarta, Indonesia, with planned expansions to Bali, hopefully in Capri, Malaysia, and Australia as well. Again, we are here today to share regarding the topics public health on islands. And we have an incredible speaker, Mr. Sudirman here, and as well as they will be allocated time for question and answer. Of course, at the end of his presentation, we will have this kind of question and answer discuss. So without further ado, I would like to introduce and call Mr. Sudirman.
Okay, thank you. Bapak Raja Hendra. Let me just share my screen first, yeah. Okay, Assalamualaikum warahmatullahi wabarakatuh. Thank you everyone for having me here for this event. It's a great honor to present this to all of you, and something that really drives me, which is nursing in the community by itself. As we go along, you will see how my experience in both Australia and Singapore could really benefit with regards to healthcare in the remote areas of Capri. Yeah, okay. So yeah, my topic for today will be connecting for continuity of care. In bahasa Melayu will be menyambung untuk kesinambungan. Yeah? So yeah. Okay, so about me, contents for today will be a little bit of talk about me, not so much, I hope, community nursing in Singapore, in Australia and Singapore, healthcare 5G, of course, on a budget, and delivering healthcare that is holistic in itself. Okay, so I've been registered in Singapore since 2007. I was first registered in Australia in 2008 and Australia-wide in 2011. I've worked in many organizations in Singapore and Australia. In Australia mainly, I worked with the Department of Health of Western Australia. In Singapore, most importantly, I've worked in the happiest hospital in Singapore, which is the Institute of Mental Health. Everybody there is smiling. Orang-orang sakit jiwa ni senyum terus. Yeah. So of course, Singapore Red Cross, Mount Elizabeth Hospital. I've even worked with Aviva, Thompson, and after that, I founded Holistic Health in Singapore. Yep. So yep. So this is just a little bit of a picture of a graph. This is Western Australia, the state by itself. Western Australia is in itself almost half of the country of Australia in itself. It has 2.86 million residents now, 2,86 juta, and the square mileage is 2,646,000 kilometers. It's really huge, and 2 million people only. So there's a lot of space, but a lot of those space is basically desert or forested areas. If you go by we look at halves, right? Everything that is around the coast is basically yang dekat dengan perairan, semuanya hijau. But once you go inland, it's all sand and desert. It's really hot, really hot. I try to avoid it as best as I avoided it as best as I can. So they don't have a puskesmas or puskesdes kind of concept. However, they do have small hospitals or small nursing homes that might not have doctors down there, and might have only 1 or 2 nurses down there. So one doctor is shared between sometimes 3 to 5 towns, depending on the size of the towns. But guaranteed they will have 1 to 2 nurses at least in that particular town. Some of the nurses work out from hospitals, some from nursing homes, hospitals, some from nursing posts, or they are even mobile also in general. Okay, so these community and hospital nurses, they understand the local concepts, local cultures, local needs and of the patients and the towns in itself. Although you might say, Australia negara bule gitu, semuanya sama itu, copy and paste, but not exactly, because Australia is unique in itself. They have the pre-Bumi people, the Aboriginal people. So you need to understand, and each Aboriginal tribe has different cultures attached to it that we need to understand, right? So how does community nursing come about in Australia? Back when I was there between 2009 to 2014, basically it was mainly phone call and driving down to the patient's house. There's no such thing as WhatsApp was not even created. WhatsApp was newly created in 2009. Not many people used WhatsApp until about 2011 in Australia. Not many people had smartphones. People were still on the 2G phones and whatnot, right? So emphasis at that time was on caring for patients at home, and with multiple programs at the state level, state capital level, and federal. Okay. Okay, something happened. Okay, so multiple programs at the state level, like hospital in the home. In other words, as best as possible, they tried to make people go out of the hospital, because the main hospitals were located in Perth. But since Western Australia is so big of an area, they had to fly people in and fly their families in. So that was a problem to the state in itself, because of the cost of lodging of the patients and their families in Perth itself. So they, as much as possible, they try to push people out to their homes, and for the care to be given in the communities, because there is no better place for a person to rehabilitate than in the community itself, in the comfort of their own home or their own environment. But community nursing in itself is laborious. Laborious bermakna kerjanya keras, harus banyak movement ke rumah orang, harus banyak telefon, banyak visiting. Kadang-kadang sometimes it can be dangerous if you're alone. Usually I don't care so much. I will just go karena we want to do it properly, but always our bosses know where we are. So it's very tiring. And at that time, some of you are quite young, so I would say especially the nursing students, at that time iPhone Gen 2 was just released. So you can in 2009 iPhone Gen 2 was about there, 2008, 2009. So you must be thinking, oh, I mean, nowadays we are iPhone what now? 15, right? 15. This was a long time ago. Smartphone technology wasn't that fantastic yet, and as well, a lot of issues, a lot of things, and like I said just now, not many, tidak banyak orang yang ada smartphone. Kalau ada handphone pun, ada HP pun, HP yang biasa aja. Okay. Okay. So this is a little bit. I'm sorry. I'm not much of a photo person, so I don't take a lot of photos. But this was one I managed to archive in my Facebook. So this was a place I visited. It's called Wild Ketchum. It's a bit unique. The place is a bit unique. This is almost into the desert. As you can see, it's just red land. Tanahnya merah gitu aja. So this this is my nursing quarters. Rumah untuk perawat. Ini rumah untuk perawat. Satu rumah, 2 perawat maksimal. That's it. Very nice, very comfortable. We get a maid to clean the house once every week. Yeah, that kind of thing. All paid for by government. So okay, yes. So these are some of my colleagues. This a long time ago. One of them is sad to say no longer around. And this is me. So as you can see, I was a bit more rounder back then. So yeah, life has a bit. Alhamdulillah, I lost a bit of weight. So this was me back then. Round, still not shaved as well. Okay. So in Singapore, now we talk about Singapore now. Singapore, managing of community nursing in Singapore is a little different. In Singapore, we mainly focus on the Singapore government is focusing a lot of management of chronic patients in the community. Pesakit yang kronik ni seperti apa? Yang ada apa tu? Tensinya tinggi, diabetes, kolesterolnya tinggi, gout. What's gout? Asam lambung is GERD. So gout is asam urat. Yes, that's the one. Asam urat. So gout, asthma. So management of these chronic patients. Why do we want to manage these chronic patients in the community in itself? Is because we do not want their problems to escalate so that they get warded into the hospital. We want to prevent that from happening because patients who are diabetic, for example, patients who are diabetic, if they are not controlled, eventually they will go into hospital for hypoglycemia or even hyperglycemia. That is the common issues that we have here in Singapore. And especially more than 40% of chronic patients in Singapore, the prevalence of chronic patients in Singapore are people above the age of 65. And this group is very vulnerable, and we try to keep it as best as possible in Singapore, in the community itself, for the community nurses and the GPs to work together to assist to achieve this target. So we screen them, work with the GPs, like I mentioned just now, control to ensure that the illness does not escalate further. As well, it is also to help management of post-discharge patients. Post-discharge meaning untuk pesakit yang udah baru habis operasi, surgery and all that. So and they don't need to be in hospital for so long. For example, a laparotomy was done or appendectomy, right? Taken out the appendix, right? Why do you need to be in hospital for so long? After a few days, you can go back. The wound can be treated at home. Lukanya boleh dirawat di rumah, and kalau boleh dirawat di rumah, boleh di-manage di rumah dengan informasi yang ada di situ dengan daripada perawat, feedback ke rumah sakit. So the doctor di rumah sakit. This will help the patient get better at home because for being a nurse and also sebagai seorang perawat dan juga dulu saya pernah jadi pesakit di rumah sakit juga. In rumah sakit, you don't get better. Actually, you get worse. You always want to just go back as quickly as possible. So and also mental health actually. mental health patients tend to, once they go in, they stabilize a little bit. Then we in Singapore we try to push them out at home too, right? And this will also include administration of regular medication, injection, and like I mentioned, it's not wound dressing, and also the management of care at home. Okay, that's that. As well, so community nursing in Singapore and also I believe in Indonesia or any other place in the world, it has been there for a very long time. In Singapore, but talking about Singapore, in the early part of last century, up to the 1980s, most of the nurses were because Singapore used to have a lot of kampungs and everything. So the nurses would go, the nurses and the perawat and the bidan would be going around house to house. They know this house ada ibu yang hamil, that house ada bapa yang sakit and everything. So they understand which house is like that, and and they did not have the technology back then that when I had in 2009 and which we have now in 2023. So and we focus a lot on the and they focus a lot of understanding the patients, understanding the culture around it, and the environment that the people and the environment then. But it slowly moved away from the community nursing component because the kampungs are no longer there, and a lot of focus was for the community was done at the polyclinic level. A polyclinic, I would say, would be akin or similar to the post-case concept. It's just that the polyclinic doesn't have beds for the patients to stay in. So from the polyclinic, if you're not well, of course, they will refer you to the rumah sakit here in Singapore. Okay. So, and during there was a tech surge in between 2010 to 2015, an emphasis was on usage of tech to care for patients at home itself. Usage of tech in like a lot of usage of applications, downloading of this app, that app, and everything. So to push for a lot of these things at home. But the main point is, the reason for this is almost everybody has a smartphone. But you must understand, that does not mean everybody has a smartphone. So tech is not always the answer. We need to understand the digital literacy of the individual person. Sometimes even a 20-year-old does not know how to use your Android phone or your smartphone. They need to understand why. How do I use this phone for? People use the phone for basically what? In general, nowadays, people use the phone for what? WhatsApp, call, TikTok, IG. I don't use TikTok. I use so they look at videos. But back then people were using the phone only for calls and SMS.
Yes.
Hopefully some of the more elder people here would know what SMS is. I used to use a lot of SMS, and then after that we used to. So we switched to WhatsApp. So in Singapore itself, especially digital literacy is still quite low for people above the age of 65, and it is hanging at about 40% according to Tada and Tan. Even those who know, they only know how to use WhatsApp, and that took some time by in itself to understand the usage of WhatsApp. So it is important that although technology is needed, the nurse-patient relationship still needs to be there, so that we are able to grasp our connection with our patients, and of course appropriate therapeutic touch. Yep. Okay. So as you can see, I stole BPJS Kesihatan logo, so it's going to link to there. So we understand, but so how do we deliver this idea of a holistic health? Holistic is, I tried to be I use the word holistic, TIQUE, because it's we tried to use a different language. So, but it just means holistic means I'm not using when we use holistic health, people always think holistic health is basically something that you are talking about herbs or that kind of wellness kind of things, like yoga and all that. Not really entirely. We are open to that kind of understanding, but when you talk about holistic, it is mainly holistic as in comprehensive in itself. All right. The comprehensive understanding of the patient, the comprehensive understanding of the environment of the patient, looking into the ecosystem of the client in itself. This is what holistic is all about. So when you understand your patient's resources, and your own resources itself, meaning apa tau? Understanding of patient resources, status keluarganya gimana, status fizikalnya gimana, status keluarganya gimana gitu. Your resources is what materials do you have? Ada risalah atau something like that for you to give to the patient. Patient strength and weaknesses does not necessarily mean tenaganya ataupun fisiknya. It also could mean other things also. And so looks at the family as well. Pereratan antara keluarga tu gimana? Is it strong? Because if it's strong, patient will heal better. But if it's loose or even renggang, it's going to be difficult for the patient as well. Okay, this is something I took from mental health. Creating a therapeutic milieu or environment for the patient. In a sense, you create an environment that is suitable for the patient's recovery at home. If it is not, for example, if the patient lives in a we cannot force patients to. If the patient lives, jika pasien tu tinggal di sebuah gubuk, you cannot force him to leave the gubuk, correct? That has been his home for many months or many years even. Dah berapa tahun dia tinggal di gubuk tu. Walaupun gubuk tu buruk, itu rumahnya. So, what can you do? Apa yang kita sebagai perawat di dalam masyarakat, apa yang kita boleh lakukan untuk menjadikan tempat, tapi dia ada luka di kakinya ni, it has to be a clean area. So, what can we do to change that gubuk into a place that is clean for his wound to recover properly? So maybe there are certain things that we can, I believe that all of you will be smart enough to do to make it maybe a certain area clean, and also very more frequent dressing instead of every other day. You need to do every day kind of thing. But also look into the patient's resources. Does the patient have enough money to pay for the rawat luka every day? So, and work within the patient's ecosystem. Ecosystem meaning not only looking at the wound of the patient or the patient in itself, but at the family, the environment, the tetangga around that, even with the Pak RT and Pak RW want to come on board, also fine. Yeah? We can work into that to help the patient, because it doesn't take one person to heal it doesn't take only the patient to heal himself. Sometimes it takes a whole village, satu kampung untuk membantu. Also, like I said, you need to understand the resources from the government. Does the patient have BPJS? Right now, from what I understand, BPJS, everybody needs to have, right? Correct. And then, or maybe he has private insurance. Does he have his own individual finance and all that? And most importantly, like I mentioned about the patient who lives in the gubuk, you need to be a little bit creative. How creative you can be, it is unlimited. You can be as creative but creative, of course, within means of practice. How you are practicing as a nurse, you need to understand how we can develop your practice in the community to suit to the patient's needs and suit to the patient's healthcare needs, right? So healthcare 5G, okay? So when I say healthcare 5G, one second, yeah. When I say healthcare 5G, when you say now on your phones, of course, all of you have like 4G and everything, right? Some of you even some, I'm not too sure about Indonesia, but I believe some providers provide 5G service and everything. iPhone 15, for example, has 5G service, and some of the Samsung phones as well. So, but 5G means fast, but to me also keeping it simple. Keeping it simple so that the patients understand what they do. Because if it's too complicated, the patients, even those who are highly functioning, who have very good good digital literacy, they would not want to use your methods to even better their healthcare needs. Okay, so do use technology. Technology right now is every part of the daily life. Like my what my wife mentioned to me, sekarang anak-anak muda, well, anak-anak muda meaning those 20 plus and below, right? Everybody is going down looking at the phone. Even in Singapore, what they call it, generasi menunduk, yeah, correct, something like that. So it's like you doing and everything. So technology is every part of our daily life. So it is not only, so to me, it's not only the anak muda. Even you see the kakek-kakek at the warkop or something, looking at the phone always. So because why? It's with them. So because of, like I said, videos, TikTok, Instagram Reels, Facebook, and everything. Okay, so what can we use that is simple enough? I mean, in Singapore, we use WhatsApp, but understand what can you use in Indonesia or in your area, on your remote areas, that you can use enough so that people can understand how you can include healthcare through technology into your clients' lives, into your patients' lives, right? So using a WhatsApp was easy for me. Using a WhatsApp was easy because it allowed me to communicate and monitor patients from a distance. I don't need to be there. I just need to look at the monitoring. Any issues, they will text me. Pak Sudirman, today my hypertension I already put in, but it is very high. What can you do? So they will contact me on WhatsApp. I don't need to be there. It's simple and it doesn't cost much as well. So for me, currently, I am monitoring the blood pressure and glucose for about 30 patients right now. I don't need to see them every day, but once a day, I just open up my list of patients. I go through my patient list and I just see their charts. I will show you one of the charts later of a patient that's already been discharged from my service, right? And use the usage of Google and Google Form for patient vitals monitoring, such as for hypertension, blood glucose monitoring, and all that. But with Google, it's a little bit unique. If it's Google as an organization, right? Google as an organization, you can use it's a little bit more secure. But if it's from your own Gmail or G Drive personal, right? Then you need to check on your organization's privacy and confidentiality policy. Each organization would have that. Google is technically it is secure, but you need to understand your organization's policy a little bit, because Google Form can get out there lah. Okay, you do not need to introduce, like I said, I mentioned, you do not need to introduce apps, because when you introduce apps, you introduce something new to patients. Patients will not. In Singapore, there was a study done that there were a lot of tech companies who, there were a lot of medical tech companies who were introducing a lot of telemedicine services, monitoring services, and everything. And people use it one time. That's it. There is no doctor or nurse-patient relationship down there, because it is just a phone service. That's it. There was no rapport building with the client. And clients only use it for acute things and not for chronic illnesses. So acute means that something that was needed there and then not for the chronic things. Yeah. Of course, with WhatsApp also, there's WhatsApp video now, and there's telemedicine. However, the downside of it is you cannot record it, which is also good. You cannot record WhatsApp video on your phone because it might not work. It might breach certain privacy issues. So do check with the organization for that. So this is a patient that I monitored. Apologies, the date is in American style. American style dating is the month is first and then the date is second. So in other words, the first date on the bottom here is actually 1st of October 2020. I saw the patient throughout until 1st of October 2021. And as you can see, we monitored her blood pressure until it stabilized a little bit, and eventually doctor discharged her from service. So it's not too bad. It's not too bad. So this is what we can do actually on our end, or what you can do, something that is for food for thought for you guys, for all of us. Yeah. Okay. So moving forward, this concept of healthcare 5G, Holistic Health has introduced it to our offshore clients. So in other words, we are using it for a few companies to manage the pelaut, manage the health of the crew at sea. So we are managing a few clients as well for that, from Singapore. Yep. Sorry.
It's all right.
Okay, so in summary, so community nursing in remote areas is indeed possible without being laborious, without being too manpower driven, or doesn't even have to be too time consuming too. Be smart in how you use your resources available to you and the patient, and like I said, also be creative in how you develop the rapport with the patient, and also be creative in how it can be a hybrid of physical visits and televisits also. You don't need to be there all the time, but as long as the patient is connected with you, engaged with you, that's the most important. But the emphasis is still on the nurse-patient relationship. As much as how much ever technology moves forward in our daily lives, and technology will move forward, right? With with AI coming in and everything, always remember it is nurse-patient relationship, not AI-patient relationship. Because when AI-patient relationship happens, right, there is no bond with you, patients will have difficulty trusting you. Never stop engaging. You don't have to call them daily. You don't have to call them 2-3 times a week. Once a week or once every 2 weeks, telefon. Pak Yanto, apa khabar? How are you? Kan, udah makan belum? Tensinya gimana? Obatnya udah makan belum? Udah minum obat belum? That kind of thing. The basic things. Just about establishing rapport, and chatting with them, or anaknya gimana? That kind of thing. That is what my team and I does here in Singapore. Yep. Okay. So that's it. These are my references. If you need any of it, you do let me know. And this is us. Thank you. I'm opening the floor to questions.
Thank you, Pak Sudirman. I do believe you have a lot of questions to be explained, and we all here.
Inshallah, I'll do my best. Inshallah.
And especially for those nurse boy students, you are giving them a good inspiration to be respectful.
Yes. When I started in nursing, right? Just to add on a little bit, when I was rejected into nursing 3 years in a row. 2 years in a row. I was rejected into nursing. Nursing did not want me. But the reason I pushed on to get into nursing, because why? I istiharah. Allah showed me nursing is for me. Alhamdulillah, nursing has not failed me. Allah doesn't fail me. Nursing has not failed me. So when I started in nursing, Singapore nursing, 6% male only. 6% male. Right now, nursing in Singapore is 12% male. 12%. So it's grown.
So how did you raise your own motivation? Probably ada berikan inspiration for the boy student right here.
How do I do it? I mean, just take it easy. You just need to understand know your material. I mean, not only for the boys, for the girls as well. Know your material, be confident in how you speak to the patient, and patients, you are the constant contact with the patient. I'm not saying that the doctor is there. Yes, the doctor is there, but the doctor is not always there. But the nurse is always there with the patient, at the side of the patient. How are you more valuable, or is the nurse more valuable, or is the doctor more valuable? You are more valuable. So be the resource person, be the informative information for the patient. So understand your knowledge, know where you stand, have good skills, always, constantly. Even right until now, I've been a nurse for about 17 years, 17 years. So I still do my own reading and everything. We catch up. Although I don't have a lot of time now, but I still need to do it, especially because there are a lot of new things coming up.
Okay, right. So can we start from participant, lecturer? Would you like to ask you some questions? Ada from this ruang, or participants behind
From
the
chat, Mr. Hendra.
Oh, go ahead. Yeah, this is Ibu Romalina. Yes, how are you?
Alhamdulillah.
Go ahead, Ibu. Ibu Romalina is one of my favorite participants in my class. Go ahead, Ibu. Ibu Romalina, you need to unmute your microphone.
Boleh campur bahasa Indonesia ya, Mr. Hendra.
Go ahead.
Boleh.
Yeah. I understand.
Thank you for attention. I want to ask for Ms. Sudirman. Indonesia punya BPJS Kesehatan. Dari penjelasan tadi bahwa Australia mampu membackup perawatan pasien di rumah untuk perawatan-perawatan di rumah, salah satunya perawatan luka. Sementara di Indonesia sendiri, BPJS sendiri tidak bisa membackup yang di rumah sakit untuk perawatan luka modern. Saya kebetulan punya perawatan luka mandiri di rumah. Pasien yang datang ke tempat saya itu pasien-pasien pasca dari rumah sakit yang hampir diamputasi. Apa yang harus kita lakukan dengan kondisi seperti ini, karena BPJS tidak bisa membackup kondisi. Terima kasih. Thank you.
Alamak. So, how can I say this? Okay, so di Australia dan di Singapura, kalau seseorang pesakit tu, pasien tu udah keluar dari rumah sakit dengan kondisi yang begitu, dengan untuk rawat lukanya, kalau misalnya di Australia tak menjadi masalah. Di Singapura, kalau seseorang tu dalam kategori subsidi yang tertentu akan mendapat bantuan dari pemerintah untuk biaya rawat luka di rumah. Okay, nah di Singapura BPJS udah berapa tahun ya, quite new kan, kalau tak silap saya. Nah, ni dengan saya ngomong sama beberapa rumah sakit di Jakarta dan di Depok, kata mereka juga BPJS tak mendapat perawatan di rumah, tidak dapat claim daripada BPJS. Nah, so this is a conversation that I need to have with you privately. It cannot be on record. But what I can say is, there is a way to do everything. We need to be we need to understand a little bit how best we can serve our clients within the resources and playing around the system. So it is sometimes, so there's two things we need to do now. Ada dua perkara harus dilakukan sekarang. Pertama is don't fight the system, but find a way to go. Jangan lawan sistemnya, tapi cari jalan untuk go around the system. Go around the system, but to ensure that the patient still gets the assistance that they need. Number one. Okay, that's the first one. Itu yang pertama. Yang kedua is you lobby. As nurses, we need to lobby for our patients because the patients cannot lobby. The patients are sick and their families are tired because they are taking care of the patient. So as nurses, we need to put it up to higher management within our hospitals, within our rumah sakit, within our management that this is happening. It cannot be. If we don't save the clients, our patient's leg, it's going to be amputasi now. How can we help? So lobbying with hopefully governor is not there, so if the governor is there, what to do? But lobbying with your provincial government and then eventually your federal government, which is Indonesia state side, that would help. So yeah. So if another question, how best to beat it? Do ask Pak Hendra for my email, then we have a different conversation when I come to Tanjungpinang, inshallah.
We should ask Mr. Director to call you and to be here next time.
Okay.
How is it, Ibu Romalina?
Thank you, Sudirman. Yeah. I want to ask. Thank you. Yeah.
Go ahead. Go ahead, Ibu Romalina. You've got another question?
No.
No. Okay. Thank you. So anyway, it's always coming back to governments, yeah. So next time maybe we can have a private chat with.
Yes, we can have a private chat.
Next, from participant back home behind the laptop, or okay, Ibu. There we go. Can you screen, Ibu? Yeah, go ahead. From the lecturer, Ibu Tiara. Lecturer Tiara.
Thank you, Mr. Moderator. Assalamualaikum, Mr. Sudirman.
Waalaikumsalam warahmatullahi wabarakatuh.
And Tiara from Midwifery Department of Poltekkes Kemenkes Tanjungpinang. Thank you for your introduce holistic health for us. The concept is very impressive, and holistic health is cerebral and spirituality aspect, and how we can give the care of that, like spiritual approach for patient. As we know, the technology influence the people too, especially the health. I'm very interested in the spiritual care for midwifery, and the thesis of me last it is the spiritual for pregnant mothers.
Okay.
Thank you.
Pak Indra can repeat the question to me. I didn't catch it. Or maybe Ibu can repeat the question again. Spiritual, you are interested to understand the spiritual concept of assisting pregnant mothers. Is it? Is that your question?
Yes, but how we can give the care of the spiritual approach for the patient.
Okay, can understand. So okay, for the spiritual component, of course, we need to understand first what are their beliefs. Some people are Indonesia mainly is Muslim, so you have Muslims, Christian, Buddhist, Hindu. So that firstly you understand what are their beliefs. That's number one. But always be true to yourself. Always be true to yourself. If you are not their faith, do not try to impose your faith on them. But if they are Muslim and you are Muslim, it is important that you do it Shari'i. You do it Shari'i correctly, and you when you introduce this to them. So it depends also. Are you talking about pregnant mothers who need ruqyah or something? Okay, pregnant mothers who need ruqyah. Indonesia ruqyah I know is very popular is Ustaz Faizar, who's on Instagram. Very fantastic. I also follow him on Instagram. I think my video hang. But you guys can still hear me, right?
Yeah, we can still hear.
Okay. So my face looks so weird on the video, right? But we need to understand how spiritual does what level of spiritual care is really needed for the client in itself. The reason I say we need to go ruqyah Shari'i really well, because why? We're talking about pregnant mothers here. There are peruqyah yang wanita, so you try to get them peruqyah wanita, but the good ones are always the male peruqyah. So ensure that there is no touching involved, because some peruqyah are quite touchy, which is not good. So and when you involve spiritual care, you need to involve the family as well. So because spirituality is not an individual thing, it is a family thing. They need to do it together. So more or less, I hope that answers your question. Yep.
So basically, back to the family involvement, yeah.
Back to the family. Okay. It's back to the family, and also back to the perawat as in the peruqyah itself.
Right. Okay. How is it, Ibu Lecturer Tiara?
Yes, that's enough. Thank you for the great answer.
Okay. Thank you.
We still have another few minutes, Pak Dirman. Would be all right? Let's say another 10 minutes more.
Yeah, no problem.
Okay, more questions, please, from participants. Probably Bu Indah. Yeah, I think you have that kind of question to be explained. Ibu Indah, Lecturer Indah, or from the room? Okay, here we go. Back to Bu Safra. Here we go.
Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
My name is Safra, and mine is not really a question, but could you please share to us what community nursing care in Singapore or Australia, especially in school settings. I mean, what the nurses do in schools, what their programs, and any interesting cases. Thank you.
Okay, so in Singapore or in Australia, in Singapore itself, uh, back in the 1980s and the 1990s, every school had a nurse. Every school had a nurse, but they find that there were too many schools being opened up in Singapore and too little nurses to go around. So what they did was, all these school nurses were centralized in one location, and they developed there's a school health service now under Ministry of Health. So school health service, they have doctors, nurses, and everything, have a structure and all that. So these nurses go around school to school, to check the students, of course, physical body check and everything, give injections and all that. But they also run in Singapore, they also run programs for the kids, for the students up to the age of 16. So what are the programs that they run? It would be dependent on what is prevalent what are the prevalent illnesses in Singapore for kids and also very young adults. So, and number one in Singapore, program that is run in Singapore is obesity. So to fight obesity in Singapore, is being it's a developed country issue. Obesity in Singapore is prevalent, is growing up. Currently, if I'm not wrong, I need to check again, is we are sitting at about 30% obesity for the country itself. Food is too good, and especially Batam is so near. We just cross over to Batam, buy good food, and you can come and eat. So that is one area that they look at, and also they look at obesity, smoking issues and everything, and other things such as how to eat right, and as well as dental programs. So these are the main things that is run here in Singapore. On top of that, of course, you got your dengue fever issues, and they do touch a little bit on other things such as chronic illnesses, but that is for a relay of message to the parents itself. So these kind of things. So sometimes programs are run for the kids, but in actual fact, the message is for the parents at home. So in Australia, they do similarly. They have one nurse. The concept is similar to the hospital system. They have one nurse to two or three a few schools.
Sarah? Hold on. Pak Sudirman is still disconnecting. Before we come to Pak Indra Matias, would you hold on for a while? Hold on, let me just try to call Pak Sudirman back in Australia.
Bisa disebut.
Okay, that's all right.
Amat daripada yang
Hold on. He's coming back.
Hello?
Yeah.
Can you hear me? So sorry. Okay, Ken. So Ibu, just now I was saying, where was I? We're talking about the Singapore School Health Service. Where did I stop at? Where did I stop? You stopped hearing me?
Yeah, we can see you. Good.
Okay.
Right.
Okay. So basically, in Australia, it was basically a similar concept, like I mentioned. One location, we have three people. One nurse to three different schools and everything. Not much of programs. Mainly to serve the medical needs of the students in school, but the programs that they do run on the occasion is mainly alcohol drinking at a young age, smoking, drug abuse, and also at one point of time they had some issues with children sniffing petrol. So kids, as this is especially for the Aboriginals or the pre-boomy in Australia, they had the issues of these kids will go around taking drops of petrol, put it in plastic bags and sniffing it to get a high. So that was very much a concern back then. I hope that answers your question. I know there was some parts that were missing. If you can always you can always email me if you need to understand a little bit more. No issue.
That's Ibu. Yes. Right. Let's come to Pak Indra Matias here. We've got Pak Indra from.
Thank you, Mr. Moderator. Can you hear my voice?
We can hear you, but we don't see your face.
I'm sorry, I can turn off my camera.
Oh, okay, go ahead.
Okay, Assalamualaikum, Mr. Sudirman.
Waalaikumsalam warahmatullahi wabarakatuh.
I want to ask you about something out of the context.
Okay, sure.
Let me introduce myself. My name is Indra Martias from Sanitation Study Program.
Okay.
It's about how is your country making effort to develop health tourism. As we know, your country is the top 3 health tourism in Southeast Asia.
How do you do it?
Okay, that's my
how
question.
do you do? Yeah, I understand. We had this. We had this discussion at KBRI a few months ago. No, I think earlier this year. Not me, but in general, KBRI invited a lot of companies over, and one of my guys came into KBRI because we know Indonesia is trying to promote medical tourism into Indonesia itself. Why I know that there is Preta Medica is building Bali International Hospital in Bali. So okay, how Singapore developed its medical tourism in Singapore is basically, it took years. It's not overnight. I would say the same for Malaysia as well. We developed it through a proper by developing a proper infrastructure from not only from the medical side of things, but also other facets as well. We are looking at because medical tourism in Singapore was mainly looking at private hospitals like Mount Elizabeth Orchard, Mount Elizabeth Novena, Gleneagles and everything. But at the same time also, you must not forget that for these hospitals to be promoting that Singapore must be proposing that we have a strong healthcare infrastructure. And strong healthcare infrastructure means that our public system itself is already that good or comparable to our private infrastructure itself. So this is one area that slowly, if let's say you need to move to that direction of medical tourism, your public and private infrastructure needs to level up together. It cannot be like wow, you got Siloam Hospital, and then after that, your smaller hospitals are not there. So it's not fair. It's not fair. So when you got good public and private hospitals, that means the care or the manpower that is delivering the care is same for both. So in Singapore, public, for example, NUH or some of my Indonesian friends like to call it is a public hospital itself, and we still get private patients going there. So why? Because it's good. And then you got people going to Mount Elizabeth and Glen Eagles and all that. So we need you, and so that means that the care being delivered there, it means that the manpower is good, the tenaga kerja is good, similarly to the private hospital as well. So we need to improve. So improve in that manner together. Yeah. So more or less that is how, and it's not a 3, 5, 10-year program. It's a 15, 20-year program. Malaysia took a long time to be on the same par in Singapore, but still it's healthy competition, I would say, and I welcome more. Singapore welcomes more competition for the area lah. No problem.
Thank you, Mr. Sudirman. It's great
No
answer.
problem. Thank you.
Thank you, Pak Indra, and good luck with your further educations and your thesis S3 ya, Pak Indra. Now, we're coming back again to Pak Adil Chandra. Welcome back, Pak Adil.
Okay, thank you, Mr. Hendra. I want to ask again two question. If two question, I take an umbrella. So sepenat ya. Okay, thank you, Mr. Sudirman. I am nurse. I'm the special to concentration community health nursing.
Okay.
I interest you say about your presentation. Community nursing is remote area in Singapore. Yeah, in Indonesia, nursing community is special to study. If a case about my wife refer to my wife especially is if I case to mental health, case to nursing mental health. Nah, two question. There are five simple about nursing community. Number one, to use technology. Yeah, there are many research about technology about nursing. Make to application telehealth and they are. The two we are other chat service. Now, I'm is a patient blood pressure, head blood pressure. No, yesterday I went to health center in Sungai to control my blood pressure. In Indonesia, not to health center 1 month again to call me, Mr. Adil, back to health center about you control blood pressure. What about in Singapore 2 minutes telemedicine or call WhatsApp and Google Form? Thank you, Mr. Sudirman.
So the first question was the second question. I understand. How do you control blood pressure? What was the first question again?
Yeah. I'm fashion the blood control. Yesterday I go to health center in Indonesia, Sungai
for blood control.
Center. Yeah.
Okay. For blood control. Okay. So for untuk yang test darah gula Pak dan juga tensinya untuk for me in Singapore, it's basically I use WhatsApp and Google Form or Google Form. So Google Form, because our holistic health as an organization, we have a dedicated private Google account. So we send the Google Form to the patient. Every day, the patient enters in the blood pressure number. So they have only 3 slots: systolic, diastolic, pulse reading. That's it. So, and then that is every day and comes out our chart that you saw just now. So that is how we monitor them. Or if let's say they don't know how to do that, right? They just WhatsApp me the picture or that one, and we enter the details ourselves. This is how we monitor our patients for the glucose or even the hypertension in itself. In Singapore, this is how we do it. We keep it simple. I understand there's a lot of technology out there, and people have been trying to sell me a lot of this technology as well, but no need, because it costs too much for the patient. It costs too much to us as an organization as well. Okay. Was there another question, Pak? I'm so sorry.
Yeah. The first question: community nursing is a remote area. What about the remote area in Singapore?
Okay. Well, Singapore is too small to be remote, of course. Singapore is smaller than Batam and Tanjungpinang, the Riau Island. So there is no remote area in Singapore. However, there are people living remotely. Hopefully you understand. So orang tu dia tidak tinggal jauh, tapi dia menjauhkan dirinya. So it is a challenge for us, adalah sukar bagi kami untuk mendekati orang yang menjauhkan dirinya daripada perawat, daripada doktor. So it is so when we are given this task to say okay, so we cuba mendekatkan diri ke mereka so that they don't feel so remote from the community or at least from the healthcare system in itself.
Okay, thank you, Nurse Sudirman.
Okay, thank you.
Yeah, okay. Yeah, thank you, Mr. Hendra. I give some pantun for Nurse Sudirman. Okay, right?
Okay. Oh, you got pantun.
Okay. Aura kasih ke Balikpapan.
Lawa.
Makan astor di Matraman.
Lawa.
Terima kasih kami ucapkan for Nurse Sudirman from Singapore.
Okay, amin. Saya pantun saya kurang sikit, Pak. Saya minta maaf, Pak. Terima kasih, Bapak. Terima kasih.
Thank you, Nurse Sudirman. Thank you, Mr. Hendra.
All participants, we are sorry to inform you that we are coming to the end. It's 1 minute to 10 o'clock, 1 minute to 11 o'clock local times. Pak Sudirman, before we let you go, would you stay for a while to issuing you a certificates?
Okay, can.
Go ahead. Here we go. Okay, Pak Sudirman, thank you very much. And all participants, thanks for having us.
Okay, thank you for having me.
Yeah, thank you. Then I would like to also ending this session with my pantuns, Pak Sudirman.
Masya Allah, pantun everywhere.
Harus dijawab, Mr. Sudirman.
Nanti saya jawab lewat WA aja.
Siap.
Pakai tanja oleh Hang Jebat digunakan oleh Raja Indra. Seminar Internasional Poltekkes Tanjungpinang telah dibuat. Semoga murid-murid di sini berjaya.
Amin.
Amin. Alhamdulillah. Thank you, Nurse Sudirman.
Thank you.
Thank you all participants.
See you again.
Yeah, we will come to. Thank you, Pak Sudirman. We will having a keep in touch with you. Next session, we come to the next speaker. I would like to hand over this to my very good co-moderator, Mr. Harvan. Anyway, Assalamualaikum warahmatullahi wabarakatuh. Thanks for having me.
I'm free.
Well, now on, we shall, may I see the third speaker from UK, Mr. Murah? Have you been here with us?
Yes. Hello.
Hello, Mr. Murah.
Hello. Can you hear me?
Okay, of course.
Yeah, thank you so much.
Mr. Murah, for a little bit intermezzo, what time is it now in London?
Yeah, actually, I live in Liverpool at the moment, so it's 5 p.m. in the morning, so it's kind of like sleepy. Yeah.
5 p.m. in the morning.
Yeah.
In Tanjungpinang is 6 hours earlier, so now is 11 o'clock a.m. Okay. Another question, what kind of season now in Liverpool?
Sorry, could you say it again, please? Yeah.
Excuse me?
Sorry, could you say it again, the question?
Can you hear me, Mr. Murah?
Yeah.
Winter or...
Oh, yeah, sorry, the weather. Yeah, it's autumn. So it's like transition from summer to winter. So yeah.
Okay, Mr. Murah, shortly, we would like to introduce the third speaker, foreign speaker, international speaker from UK. May I, Mr. Murah? Mr. Murah has a title first degree, Bachelor of Public Health from Udayana University, a master degree from Mahidol University, Thailand, and Doctor of Philosophy from University of Wollongong, Australia. Next, now he is a postdoctoral research associate from University of Liverpool, UK, and professional development. Now he is ad hoc peer reviewers for selected journals, dissertation supervisors, and many excellent activities that we can mention one by one, Mr. Ngurah. And now we are pleasant to give you at least 40 or 45 minutes to present your papers.
Yeah.
Thank you.
Okay. Okay, thank you so much, Pak Moderator. Yeah. So I will share my screen. I hope that everyone can see clearly my screen. Okay. Pak Moderator, could you confirm whether you can see clearly my screen, please?
Of course.
Yeah, okay. All right. Okay, I will start the presentation. So thank you so much again for Pak Moderator for very kind of introductions. So let me introduce myself again. My name is Eddie. So from my full name, you can tell me I'm a Balinese, I'm an Indonesian, but at the moment I live in the UK for doing a postdoctoral as a postdoctoral researcher at the Department of Psychology Institute of Population Health to do some research about the mental health and obesity. But for this very special occasion of the first International Conference Center of Excellence, ICCOE of the Health Polytechnic Ministry of Health Tanjungpinang 2023, I would like to present the work that I have been doing. So in this conference, I would like to share with you about how the place we live or the place you live can determine your health. So a little bit about my background, as the moderator explained before. So I did my undergraduate degree in public health at Udayana University, Indonesia. So from 2012 until 2016. And then I decided to move to Thailand to take a master degree in population and sexual reproductive health at Mahidol University, Thailand for a year. And after that, I got a job. Actually, I did job like 9 months job at Udayana University as a researcher before doing PhD, moving again to Australia in 2019 to do PhD at University of Wollongong, Australia. So this is the first time I got exposure about the knowledge, how the importance of the place we live can influence our health. And then after I submitted my PhD thesis, because I couldn't find a job in Australia or Indonesia, so I decided, okay, let's do a postdoc. So maybe it's time for me to learn something new, I guess. So that's why I decided to do postdoc as a researcher, working as a researcher or research staff at the University of Liverpool in the UK. So I have been here since last year in March 2022. Until now. So that was a little bit about my background. So for starting the presentation, I would like to ask to you all. So this is something you might need to remember, I guess. So my question I have for you is, why should we stop thinking that someone's health is merely based on personal choices? Because there are a lot of cases, I guess, in society when people having health problems, another people surrounding that person tends to judge that person because having a health problem, because they thought that that person's problem is merely based on personal choices. For example, if we see someone having obesity, for example, in the society, maybe other people will try to judge that person. For example, is that person should exercise more and eat less. So that's like the simply I guess the simple example about how other people sometimes judge the condition of another person because they thought that the condition of that person is merely based on personal choices. But sometimes I think beyond these personal choices, sometimes we need to consider about other factors might also influence personal choices that sometimes we didn't think about that. And another example here, I think we have in Indonesia, especially, we have a big problem of stunting, I guess. For example, in this figure, we can see the differences in the prevalence of stunting across more than 30 provinces in Indonesia. And from the figure, we can see the Bali has the lowest prevalence of stunting. Meanwhile, another province just next to Bali, Nusa Tenggara Timur or East Nusa Tenggara, has the highest prevalence of the stunting. So my question is, can we blame the prevalence of the stunting because the way of parents feed their children only, or should we think that maybe the differences of the prevalence in stunting because of other factors beyond of the individual factors? Maybe because of the system in that province are different, maybe the location of that province are different, or maybe other type of factors, external factors such as the environment where people live can be also be a determinant of the stunting in that province. So maybe a lot of people think that people health is sometimes based on their choices, but the things that you need to bear in mind that sometimes people choices are constrained. It's according to what Professor Iccoe, which is one of the social epidemiologists at Harvard University, someone that I admire because of his work on the social epidemiology. And during the interview, he said that at one level, people are responsible for their own lifestyle choices, but people's choices are constrained. They are constrained by the conditions under which we grow up, education that we receive. So that's why even though we might blame individuals' health because of their own choices, but we need to also consider that sometimes their choices are constrained or limited because of their education or because of the place where they live at the moment. So the things that I would like to emphasize here that social and physical conditions where people live or where people grow up or work can shape or determine their health. So in order to understand why people getting sick or keep their healthy, we need also to consider like other factors beyond of the individual level factors that might have important role in shaping or developing people risks of particular disease or any kind of health behavior. So how should we understand health? So because the WHO here defines health is not only about physical or the absence of the disease and on the body. So it's not only about whether someone having a health problem or not, but also health is some things about like mental and social well-being. So there are a lot of like aspects that can influence health here. It's not only like a virus, bacteria can make people get sick, but also the social context, like how people having interaction with neighborhood sometimes can also influence their mental health, which is something becoming more concerned, I guess, in Indonesia and other developing countries because mental health, a lot of suicide cases because this person who did suicide cases, they don't really feel a social connection with people surrounding them. So that's why they decided to have suicide atau bunuh diri. So it's important sometimes we not only consider about like a biological or like chemical factors that can influence whether people can get sick or not, but also we need to start thinking about the social context or maybe the environmental context where people live that can influence their health. So I guess everyone might know what is it the at the right side of the slide is the social determinant of health, which is some things that I do believe that we have learned from our undergraduate degrees. And from this social determinant of health, there are several factors that can influence why people getting sick or why people can maintain their health. So starting from individual level factors, the inner circle, which includes age, sex, and other factors at individual level. But also there are other more distal factors that are located beyond of the individual level factors, such as social and community networks, like how good people having relationship with neighbors in the place where they live. So all the factors that are located beyond of the individual level factors, particularly those factors at the place where people live. But also there are other factors here that more wider compared to social and community work, such as the living and working conditions, because these factors are very important that can shape people behavior. For example, here we have agriculture and food productions, because this factor very important that can make why people living in certain area can have access to healthy, but other people in another area cannot have access to healthy or nutritious food, for example. I think it's clear example when you compare between people living in Java and Papua, I guess, because people in Java, they have easy access to healthy food and other types of foods compared to people living in Papua. So that's why agriculture and food productions can influence what people eat and what people can have on daily basis. And also we have here level of education. Of course, access to education is very important because it influences the job that people are going to do in the future, and also the type of level of income that people will earn. So it's kind of like very important factor. And also the work environments where people work and how the exposure to stress and other types of environmental context that can influence people work, and also other types of wider factors such as unemployment, water and sanitation, healthcare services, and housing. And also even more beyond factors is the general socioeconomic, cultural, and environmental conditions that can influence people's health, like what national policy Indonesia has at the moment also have an impact on people's behaviors in that country or in Indonesia. So from those different social determinants of health, I guess we can classify them into 5 different sectors. So start from the economic stability, and then we have education access and quality, healthcare access and quality. We have also here social and community context that can influence people behavior and also people odds to get sick or to maintain their health. But also we have here very important factors that I would like to talk during this presentation, which is neighborhood and built environments. So these factors are more likely to be factors that are available in the place where we live at the moment. For example, from the type of the housing and also population density, the transportation and walkability, green space or lahan hijau, and aspect of safety and etc. So basically, neighborhood and built environments is the characteristic, including physical characteristic and also social characteristic of the neighborhood where you live. Because these factors have might have indirect or direct effect to your health and also to your behavior. So sometimes as people working in public health, we need to also consider these factors because personal choices or people's behavior might be influenced strongly by these factors. So people who have interest in understanding the association between the place where we live and possible health and behavioral outcomes of that sometimes classify themselves into two main fields of epidemiology. So the first one, social epidemiology, and the second one, environmental epidemiology. So basically, these types of epidemiological study tend to understand how the place or the context of the place where we live can influence our health. So for the social epidemiology, it was defined as the branch of epidemiology that have more concern on social interaction and social conditions that have impact on people's health. And for example, those working in social epidemiology area that call themselves as social epidemiologists try to understand the potential impact of the socioeconomic status, race, gender, workplace impact of neighborhood, social network, and support. So basically, this social epidemiology also understand impact of neighborhood, which is a part of our context right now, because I'm talking about this at the moment. Meanwhile, for the environmental epidemiology, also assess the impacts of neighborhood on health, but have more focus on physical, biologic, and also chemical factors that are available in the external environments. So I guess the differences might locate at the aspect of the environmental that each of this branch of the epidemiology have a focus. For example, social epidemiology might more likely to focus on the impact of the social context of neighborhood or the area where we live. Meanwhile, for the environmental epidemiology are more likely to study the physical, biological, and chemical context of the place where we live. So basically, for those people who have interest in understanding the association between place and health are more likely to define themselves in each of these study area, depending on their research interest, whether they are more likely to understand social context or more about like physical, biological context of the place. So for this, I would like to emphasize actually why understanding the association between place and health is very important. Because as we know that living in poor environments are more likely to have an impact on behaviors of the people. For example, I guess in the case that we have right now in Indonesia, I guess it was 2 months ago in Jakarta, for example, because of the air pollution that have impact on health risk behavior, because people are more likely to get sick of respiratory problem, and also people might not want to go outside because they just want to protect themselves from the air pollution. So that's why they might have a more likely to be physical inactive compared to other people living in more area with without air pollution. So there are risk factors of physical inactivity, and also people are more likely to have respiratory problem because of the air pollution. So that's why, because of the living condition that which is very not good for their health, so that's why they get sick and having health problems. And then once they get health problem, they are more likely to go to hospital or primary care to get treatment and medications until they feel well or go back to the first condition they have before having the health problems, and then they decided to go back to the same living environment, which is the place where they got air pollution in the first place. So that's why they are more likely get sick again, because they go back to Jakarta, for example, when the air pollution was high. So that's why it's kind of difficult for them, because the same type environment will make them feel sick again because of the exposure of the air pollution. So that's why the association between place and health is kind of like the circle here. So that's why it's very important to break the cycle. Because if you just only ask people to wear a face mask to avoid air pollution, I think that's not make the sustainable action, I guess, in order to prevent them from having health problem. Because sometimes we need also to eliminate or remove the exposure from the environment in order to make people live better and healthy. So that's why sometimes it's not enough just only encourage people to have healthy behavior without trying to eliminate the risk factors at the environment. So this is another example why the place can influence health. And I guess a lot of people might know this picture, where is this picture. So this is one of the tourist destination in Bali, and a lot of people love putting this picture on Instagram and make the hashtag healing to Bali, for example. And have you ever noticed that why people love visiting Bali, and why sometimes you feel yourself relaxed after visiting Bali, for example, or visiting nature? So a lot of people went to Bali because they want to relax, want to enjoy the place with the nature, like going to beach or going to some green area, because they find themselves relaxed after visiting those places. And maybe there is an explanation why visiting nature or green space or lahan hijau is good for our health, for example, from the perspective of the science. So actually, there are three main pathways why visiting green space or one of the attributes of the place, such as green space or lahan hijau, is very good for our health, not only just physical health, but also mental health here. There are three main pathways that have been theorized by the researchers so far. So why green space is very important for our health. Having more green space can bring more benefit for people living in that area. And one of the pathway is reducing harm or mitigating harm, because the availability of green space or lahan hijau in Indonesia, or having more trees in that area, can reduce the exposure to environmental stressors such as the air pollution. So that's why in big city they really have a problem with the air pollution, because they don't really have enough green space that have important impact to reduce the exposure to air pollution. So that's why people living in green space are more likely to have better respiratory health, or less likely to have asthma, because the availability of the green space can reduce exposure to air pollution. And also another pathway why having green space or lahan hijau is very important is because the green space can also provide another pathway such as restoring capacities. And so that's why when you feel yourself tired or feel tired and kind of having a mental breakdown after having a busy week working, sometimes you will find yourself relaxed after visiting beach, or maybe good after visiting nature, because the nature can help you to recover your attention, or try to make your stress reduce after spending time in nature. So that's why green space is very important for our mental health. Trying to spend time in green space, like an hour or maybe 30 minutes, is good for our stress recovery, and also it's good for our attention restoration. And then for the third pathway is building capacities, in which green space can provide space for people to have interactions or social interactions. And also even green space can encourage people to have more physical activity. So that's why green space is good to have to be a place where we can have more social connection with friends or family, spending time together there. And also it's good place for us to have exercise, which is good for our physical health. So that's why a lot of research suggesting that green space is good for people, because green space can reduce the risk of non-communicable diseases, where people can have more physical activity and have lower risks to develop non-communicable diseases. And then another example why the place where we live can also influence our health in the case of obesity, for example, because in the first slide, I mentioned that we cannot just blame individual with obese because their behavior of not eating healthy food or might not have enough exercise, but maybe because the place where the people with living obesity live at the moment is kind of like obesogenic environments, which means that the environments where they live are more likely to shape unhealthy behavior, such as eating unhealthy food or having uh, not enough exercise, because maybe the place where they live don't have easy access to healthy food, or they have more access to unhealthy food, such as the availability of fast food in that environment, and also less neighborhood walkability, that because in that place, on that area, there are not enough space for pavement or sidewalks, so that's why people cannot walk from one point to another place, because there is no place to walk. So that's why people just ride a motorcycle or drive a car, for example, because the availability of the sidewalk or pavement is not enough for them to make them walk from one place to another. And maybe because there is lack of green space, so there's not enough space for them to have outdoor exercise, so that's why they are more likely to maintain physical inactivity. So that's why sometimes when we see a lot of like the prevalence for obesity increasing, we also need to consider maybe the environmental factors play important role, because it's not only enough as for us as public health researchers try to ask people to have more exercise or eat healthy food when they live in the place that make them cannot do that. So that's why as a public health researcher, we need to also consider uh, factors beyond individual level factors that can shape people behavior and health outcomes. And also, this is one of the example of the research that I did when I was in Australia. So I did a research try to understand the association between characteristics of the place where we live and the weight status of the children using the longitudinal data of Australia. And this is the longitudinal data when we follow the children from age 2 years old until 14 years old. And on the right side is the development of the BMI, body mass index of children, and also the waist circumference of the children. So overall, there are three types of the development of the BMI, such as moderate increase, high increase, and extreme increase. The green lines, which is not very good for health, not very good for children, because having extreme increase means that children are more likely to develop obesity, and this not good for their health for the long run. Meanwhile, on the left side is the trajectory or the pattern of the bill improvements reported by parents within the same period of the follow-up within 10 years. For example, the green line here represent that parents consistently reported that the green space quality is high in that area or in the place where they live for the 10 years. Meanwhile, for example, the orange line represent that parents reported that green space or lahan hijau in that place are not very good within the 10 years period. And then I also did the analysis to understand whether these types of built environments or the environments where children live from the perspective of green space and heavy traffic can influence children BMI and waist circumference. And what I found is that children growing up in neighborhoods that are considered safe, better quality of green space, and low local traffic over time is a protective factor against the unhealthy weight increase in children. So that's why build environments in where children live is very important to make them have a healthy BMI increase. Meanwhile, when children live in the place where there is easy access to shopping facilities and basic services, children are more likely to have unhealthy increase in BMI or waist circumference. So that's why more access to shopping facilities and basic services make children have higher odds of developing obesity. This is the case study sorry, this is the longitudinal study from Australian context. And then also using the same data, I also analyzed the association between green space quality and heavy traffic condition and the asthma symptoms in children. And the figure here represent the trajectory of symptoms of asthma from children aged 2 years old until 14 years old. And we found that here is that children living in environments with exposure to heavy traffic condition over time are more likely to develop symptoms of asthma. So it's very important from the findings of this study, we need to consider different factors from the environments that can influence children's health. So it's not only about encourage children to wear face masks, but also try to eliminate the air pollution or heavy traffic condition in the neighborhood or in the area where children live. So another example here that I have from Ireland is not only about the physical environments do matter for health, but also the social context of where children live. For example, here in this study, I try to understand whether children from lower socioeconomic status, like lower educated parents or lower income parents, are associated with mental health difficulties in children. Because the topic of socioeconomic inequalities in child mental health is kind of becoming concern in developed country, in which we try to understand why children from lower socioeconomic status are more likely to develop mental health problems. So in this study, we try to understand whether neighborhood characteristic can explain why children from lower socioeconomic status are more likely to have mental health problems. And what we found is that the neighborhood safety, neighborhood cohesion, like how people feels belong to their neighborhood or the closeness to their neighbors, and also the social interactions with people in the neighborhood or in the area where people live, and also the aspect of the disorder or aesthetic of the neighborhood were found to be associated with child mental health. And these neighborhood domains or neighborhood characteristics or area characteristics from the social context perspective can explain up to 23% why children from lower socioeconomic status were more likely to have mental health difficulties. So this is just an example why not only physical characteristic of the place can influence people's health, but also the characteristic of the social context of that place can influence why people have healthy or unhealthy behavior. And then how about the context of Indonesia? So for the next slide, I will be talking about some findings of the study that have been conducted in Indonesia to give you more examples of how place where we live can influence our health. For example, this is one study that was conducted in collaboration with researchers from Universitas Indonesia. So I did this study in collaboration with them. So in this study, I tried to understand why the prevalence of tuberculosis is different based on district, kabupaten kota across Java Island. So in this study, I used the ecological study. So using the data at the district or city level and use the geographically weighted regression to understand the association of the aspect of the environments and how this aspect of the environments can influence the prevalence of the TB across different districts or cities in Java Island. So on this figure, we can see the differences in the prevalence of tuberculosis in Java Island in 2018. And the more red the color, the higher prevalence of the tuberculosis is in that area. So we can see that here, some districts located in Banten province, West Java, and also in capital city of Jakarta tend to have a higher prevalence of tuberculosis. And also another thing that we can interpret from this figure is that the red area are more likely to be clustered together in the western part of the province. So that's why I did more analysis in the second figure using the LISA cluster map to understand whether the prevalence is significant or not. And what we found that the prevalence of the tuberculosis in some districts in Jakarta, Banten, and West Java tend to be statistically significant, in which the red area represent the high cluster, which indicates that that area had higher prevalence of tuberculosis, which is located surrounded by other areas with high prevalence of tuberculosis also. Meanwhile, the blue area represent the lower prevalence of tuberculosis, which is also surrounded by area with lower prevalence of tuberculosis. So yeah, we found some districts in Jakarta, Banten, and West Java are statistically significant high clusters, which indicates that this area tend to be located close to other place or other district with high prevalence of tuberculosis. And also by using the geographically weighted regression, in which we also control the location of the place where the data were collected, we found that household with floor space per capita less than 8 meters square, and also the number of household reporting easy access to healthcare facilities were associated with the prevalence of tuberculosis in some districts within West and Central Java provinces. So this indicates that the factors of the environment, such as the housing factor, where people have the maybe tiny home, such as with the floor space less than 8 meters square, and also the accessibility to healthcare facilities can also have an impact on the prevalence of tuberculosis in that area. So it's very important to inform the public health stakeholders and also researcher in terms of the prevention, what we can do next. So it's not only just about try to encourage people to not smoke, because we know that smoking is one of the risk factor of tuberculosis, but also sometimes we need to think out of the box where we can eliminate potential environmental factors that can influence the prevalence or the transmission of tuberculosis disease in the community. So as a public health researcher, and I do believe as the environmental health researcher, we need to consider or we need to eliminate risk factors from the environment. So this is one of the example, and another example, I guess, from the perspective of the air pollution, where was the highlight from Jakarta. I mean, this one of the concern of the people living in Jakarta, and also Jakarta was recognized as the world's most populated city in Indonesia. And we found that a lot of people reported that themselves have the respiratory problem. And because of that, a lot of people asked the government try to eliminate the air pollution in Jakarta, because the air pollution in Jakarta have been found to be associated with more health outcomes and also higher costs of the healthcare expenditure based on the study that was conducted previously. For example, the air pollution in Jakarta contributed a lot to annual total cost of the health impact, like around 3,000 USD. So it's very important to try to eliminate those air pollution in Jakarta. And also this is the examples of green space also might be beneficial in Indonesia, because previous study found that green space in Indonesia can reduce the risks of the non-communicable diseases, and also even the green space is also good for our mental health based on the context of Indonesia, because the green space was found to reduce the risks of depression by 5 to 10% within the context of Indonesia. So the things that I would like to emphasize based on this presentation is we also need to consider intervention based on the place where we live or the place where the people live. So any interventions that aim to improve health and reduce health inequalities that are delivered at local or regional level. For example, the providing the bike line, outdoor gym, provision of housing, urban and landscape development, and other types of intervention that aim to improve the quality of the place where we live is very important to reduce the risk factor or improve people behavior in order to maintain their health. And also couple more slides, I guess. Yeah, for example, about the health problem that we have in the context of the small islands, I guess these are the common health problems that we have. For example, the diarrhea because lack of access to safe drinking water, and also poor sanitation, and even the problem of the stunting, when people tend to blame how the parents feed their children, but the main problem of the stunting is because people don't really have access to good quality food or nutritious foods. And also, for example, another problem that we have may be delayed treatment and diagnosis because people don't really have easy access to healthcare facilities. So the main intervention we need to do is how we can make the environments where people live can support people behaviors and also make people can maintain their health. So the potential intervention based on the place-based perspective is improving access to safe drinking water and sanitation to reduce the incident of diarrhea, and also for the stunting, we need to improve food environments with greater access to healthy and nutritious foods. It's not only about health promotion to ask people to eat healthy food, but also we need to make up environments where people live enable people to do such action. And also for some problem like delayed treatment and diagnosis, we need to also increase the provisions of healthcare facilities. So multi-sectoral collaboration are the key. So as a public health researcher, we cannot just work by ourselves, but also we need to collaborate with other people from different sectors because they have more resources. So, but we just only have resources in terms of how to educate people, but people from other sectorals, I guess they have more resources. So that's why it's very important to have such collaboration in order to make the environments where people live can help people to maintain their health and also to make better health outcomes in people living in that area. So the main message or the conclusion of my presentation is public health intervention should not only focus on promoting health behaviors at individual level, but also it's very important to start thinking about how to improve the quality of place where people live, grow up, and work, because these places are more likely to have direct or indirect effects on the people behavior on health outcomes of the people or the resident of the place. So yeah, start having a thinking about what types of intervention that we can do at that place. It's very important to make sure that people can live healthier and also behave in a healthy way to maintain their health. So I guess that's my presentation. Thank you so much for your attention. Please let me know if you have any questions.
Thank you very much, Mr. Murad. It's so inspiring, so brilliant that health must be built by environment. There is a new terms in epidemiology. There's social epidemiology, environmental epidemiology. So now on, all participants, it's time to make comment, make question to Mr. Murad. Enjoy the time. Someone in this room or someone by online? Is there any question, any comment?
Assalamualaikum warahmatullahi wabarakatuh. First, let me introduce myself. My name is Berniati Rukairul from Nursing Studies. Now, I want to ask a question. Mental health always coordinates with physical health. Not all people have a stable social life and good environment. This will not only influence the mental state, it also affecting the body. Like, for example, depression, eating disorder, body dysmorphia, etc. If having mental illness causes a poor physical condition, does that mean we have to prioritize restoring the mental state of the bearer to improve our physical health? Even though we know people with mental illness can't be healed instantly as a common disease do, it needs more time as whether or not the bearer can improve their mental state or not, or all the way around. Thank you.
Can I answer directly? Okay. So yeah, sorry. Okay. So thank you so much for the question. So actually, mental health is very big problem nowadays, not only in developed country, and it's becoming an issue, I guess, in developing country such as Indonesia, because we heard a lot from the social media. A lot of people did suicide because they just have mental health problem and cannot get any treatment as soon as possible. And the things that I would like to emphasize here, first, mental health problems is very important, the same as physical health problems. Because if you have healthy body but your mental is not that healthy, sometimes you cannot work appropriately or cannot do the things that as what we should do. So having prioritized mental health is as good as well as physical health. And what we have the problems in developing countries at the moment is that first, people don't really know where they should go if they have mental health. Even if they consider go to psychologists or psychiatrists, let's see what people surrounding that person will try to have any judgment, something like that. So it's kind of like mental health problems still stigmatized within the Indonesian context because when, for example, when I say that I want to go to psychologist because I want to have like consultation about my mental health problems, people surrounding me will try to judge. Are you sure? Are you there are still a lot of judgment about people going to psychologists even though they just want to have like the people to chat with or just to have the consultation with them in order to make a solution about what should we do in order to kind of like reduce the symptoms of mental health problem. And also yeah, there is a strong link or the strong association between mental health and also physical health, because mental health like depression can make you have inflammation in your body, which is also increase the risk of non-communicable diseases. So that's why in order to make people can be healthy, so based on the concept of from WHO, health is not only about the physical but also mental health. So that's why we have to prioritize both of them at the same time. So but sometimes I think depending on the resources and also depending on the understanding of the people in the society, sometimes physical health is viewed as more important than mental health, but we need to act now. So I think as a researcher and also health providers, I think we need to also start encourage people to understand their mental, emotional conditions, because sometimes people don't really understand what's going on their body, on their mind. People just sometimes express it towards or project their anger to other people, but sometimes they don't realize about what's going on. So I think promoting the importance of mental health also is some things that we can do at the moment. So it's just not only about encourage people eat healthy food or having physical activity, but also try make people realize about their emotional and also the state of mind is very important nowadays. So I think promotion is one of the key to make people can realize about the condition of their mental health. I think that's from me. I hope that answer your question. Yeah. Thank you.
Well, the question and the answer has suitable about mental health associated with environment. Is there anyone, participants? Two other speaker talks about health medication, and the third speaker talk about environmental health. Is there in this room?
Yeah, I think there's someone wants to ask question from the online participant, I guess, Pak Indra Martia.
Thank you, Mr.
Okay.
Eddie. Thank you, Mr. Moderator. This is simple questions to the Mr. Eddie. Good evening, good noon. in
Yeah,
Liverpool.
good morning. Actually, it's still
Good
5.
morning.
6.
Actually.
Yeah, 6 a.m. Yeah. Thank
Okay,
you.
thank you, Mr. Eddie. I would like to ask about the hot topic, to be discussion in your campus, especially in Liverpool. It's
Yeah.
mental health or social health and anything else. Mental health is a hot issue. Do you think that demographic bonus, what happened in Indonesia, will have a good influence on mental health, especially for the productive age? Maybe that's my questions. Thank you, Mr. Eddie.
Okay. Let's try to understand about the social context in Indonesia. First, I'm not really sure whether mental health is becoming like the top priority in our country, Indonesia, because it seems that physical health is still becoming a priority, I guess, by a lot of people, because people don't really have enough knowledge about mental health, I guess, in our country. So I think that's kind of, just becoming like a tough things that happens in our country, because as we know that people keep increasing in terms of the numbers, and also we are going to have more productive working age, like we will going to have like the demographic bonus, but sometimes in the reality we don't really have enough capacity to have like the employment to make them employed, because as we know that increasing the number of working age should be accompanied by the number of availability of the working opportunities. So that's why that's kind of becoming a problem at the moment in our country, because a lot of people cannot get a job and become jobless, I would say. So that's why this also increase possibility for them to have mental health problems, because as we know that mental health problems is more likely to be affected by the living conditions and also social context where we live, like whether you have some things or not compared to your neighbor, because as part of the Asian community, we love compare ourselves to the other, right? We love becoming like top priority in our neighbors, and also in our neighborhoods, we love to have like things that other neighbors don't have. So this kind of comparison also can affect our mental health, because a lot of studies saying that if you see yourself is more, just have like more possessions, like in terms of the material possession, you are more likely to be happy. But if you don't really have some things, like don't have enough foods, don't have enough maybe house to live, sometimes it makes you have like mental health problems, like depressive symptoms, something like that. So I think it's important for us, I guess, to recognize the mental health issue in Indonesia, because we also have a lot of cases of the suicide because of bullying, for example, at the school setting, which is need to be addressed as soon as possible. But we don't really have like mental health problems programs at the school level. So it's kind of like sad for me to say, because yeah, we know that mental health is very important, but sometimes because of the system, because of the availability of resources, we don't really consider that as an important issue compared to physical health. Yeah, I think that's something that I can share with you.
Thank you, Mr. Eddie.
Thank you so much for the question.
Still talk about mental disorder. Is there any? We have Silakan, please enjoy your time.
Hello, Eddie. Long time no see.
Oh, long time no see, Kak. Yeah,
Okay, thank you for your amazing presentation. It's so interesting. I want to ask a question. In Indonesia, we have puskesmas with so many programs, and one of this program is environmental health. There is sanitation program in puskesmas. Can you share with us how about in UK? Is there environmental health program in from the government or in public health care? Thank you.
oh, yeah, thank you so much. So the interesting thing about the UK, we have that one environmental health program. So people working in health department, I think it's kind of the same compared to other countries because we have all the programs here in the UK. And so the more interesting thing is that people tend to collaborate with other sectors. For example, for those not working in health sectors, but those might have impact on health of the people, like from housing department, I guess, or types of department that aim to improve the quality of the neighborhoods. We have that programs in collaboration. So that's why the health program will be made in order to address the health problems that we have. So it's not only about having top down approach here, but we more likely to have like bottom up approach. So what's like the main problem that we have like in the environment that we have in the environment? So the health program will be made in order to address those health problems. So we have that one. But I guess compared to developing country like the Indonesia, maybe the priority in terms of the diseases might be different because the area is not common here compared to Indonesia. But what people do here is it's not easy to sell food here compared to Indonesia. So pedagang kaki lima tuh tidak ada sama sekali di sini. Jadi so that's what the government did. So government tried to regulate everything, try to reduce potential harm from the environment. So that's part of the environmental health here. So in the government try to reduce the number of the environmental pollutants, like reduce the number of cars, and also have more public transportations. And also the government here try to maintain the quality of the neighborhoods, like make the green space or lahan hijau more attractive to people, so people are more likely to be engaged to have like physical activity and also have the social interaction in the neighborhood. So I guess all the environmental just environmental program in the UK has been integrated with other programs in from the perspective of the health. So yeah, I think we have more integrated program, I guess. So it's not only segmented. Should be your responsibility. That's not my responsibility. But in the UK, it's more likely to have like the collaboration across different departments. So that's why the public health seems much better because of that collaboration, because we cannot work together. We cannot work by ourselves. So that's why having collaboration is very important to make people have the healthy life. Yeah, thank you so much, Kak. Ya, long time no see. Ya, jadi Kak Fitri salah satu senior saya di Udayana.
Ya, terima kasih sudah mau menjadi speaker kami aja di hari ini.
Terima kasih juga untuk kesempatannya, Kak. Ya.
So interesting. Is there any before we?
I think Pak Adil Chandra wants to ask a question.
Thank you, Lee Gusti. Thank you for Mr. Henki. I want to question again. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you for Mr. Gusti Murah. Ya, saya in Bali beli. Ya, Gusti. Ya, okay. Ya, good afternoon. Good evening. I know to in Liverpool now. Okay. Your question is very good about environment in health. 3 point I know about obesity, stunting, and TB. I like to discuss about TB in Indonesia. 2 days ago, I am conference in Batam with the Kesehatan Province, Island Province, Riau Province about TB. Yeah, statement in Indonesia government 2030 Indonesia eliminasi TB. What about a strategy in Indonesia to finish eliminasi TB? Refer to your article about systemic review your presentation because I am still co-PTB, Komunitas Organisasi Peduli TB in Riau Island Province. There are some doctor, there are some nursing, and that's all. Yeah, TB, TBC, this is all all case Indonesia. In our elementary school, TB there are TBC. I'm saying no, TBC tidak bisa sembuh. I'm very lost. Yeah. No, my question for Bli Gusti about your static review. TB in Java, here in Indonesia, to province, Rio Province Island, what the strategy to finish the TB in here? Thank you. I'm now is chairman in nursing in Island Rio Province. Thank you. I'm a lecturer for so in Polytechnic Health Tanjungpinang. Thank you, Bli Gusti. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much for the question. So it's very interesting question about how to eliminate TB within the context of Riau and also within the context of Indonesia. And I guess the most important thing we need to understand about how TB transmitted, I guess, because we know that TB is more likely transmitted in the community with the high population density in which people are closely to live together, like the family member have any family member with TB, and then the TB is more likely to be transmitted around the family member. So I guess within the program, I guess we need to first try to understand what the risk factors of TB. And then if the risk factors came from the way that people live, like the people really kind of like living together very closely, like don't have enough space for people to have, just to live by themselves. I think we need to think about the housing system, I guess, like where people live, whether the house where people live meet the minimum standard or not in terms of the number of the windows to make people have the air circulation or not, whether the people's house get enough sunlight, because I heard that like the sunlight is very good to kind of like kill the tuberculosis bacteria, something like that. And also in terms of the program, I guess it's important to increase, I forgot the name, is like notification rate, because the more people get notified or the more people get detected, it means that the more likely people get into treatment as soon as possible. So that's why people can get treated as soon as possible and get cured. So that's why the transmission will be low as soon as possible. So it's very important to encourage people who have the potential symptoms of the TB to go to Puskesmas or hospital as soon as possible, because it's very important for us to get them treated, because if they have TB, they need to be treated as soon as possible. And then also once they go to the treatment, we need to also follow up whether they take the medicines on daily basis or not, because I think there's also some loss of the follow-up of the patient. So we need to have a PMO, I guess, pengawas minum obat, which is very important for them. Because in some people, because some people don't really want to, just have the medicine. So that's why having someone to remind that it's very important. So I guess it's about the whole system. So it's not only about the treatment, it's also about the prevention. We need to consider the housing. And for the prevention, we need to make sure people get the medicine as soon as possible by increasing case notification rate. And also during the treatment, we need to make sure that people get in the treatment and also take their medicine. So I think a lot of things we need to consider in order to eliminate TB. And also because we believe that prevention is better, sometimes we need to consider back why people get TB in the first place. Look at the environments where people live, try to improve the environments like the housing, something like that. So that's why people will not, so we can kind of reduce the possible transmission of TB in the community, something like that. So it's kind of the whole system. We need to think about where the TB start, when the TB ends. So we need to do prevention when the TB start. Yeah, something like that. So it's not only like it not only take like a week or month, it takes years to eliminate TB. So because we need also have some collaboration, we need to think about effective program, something like that. So yeah, it's kind of like complex, but I do believe that we can do it. Yeah. Thank you so much. Yeah.
Eliminate to TB, yeah, with together to profession. Yeah, alright.
Yeah.
Okay.
Yeah. Thank you.
Thank you, Beli Gusti. Yeah, thank
Thank
you,
you so much, Pak.
Mr. Hengki. Yeah, my question, three question. I take to three payung from panitia. I want to pantun Mr. Hengki. Okay. Oke, sungguh sedap ikan gulama, sedap dimakan di Tanjung Siambang. Sungguhnya bisa lama-lama, tapi kita semua belum makan siang. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Ya.
Thank you for all participants for attention. As finish our presentation, I would like to conclude a little bit. Besides promoting health behaviors, we're supposed to improving the quality of the place. Am I right, Mr. Gusti Ngurah?
Yes, totally right. Yeah.
It is so a remarkable session, and we proudly deliver to Mr. Ngurah certificates.
Yeah, thank you so much for having me. Yeah.
Yes, Mr. Ngurah. We are thankful to invite you in other conference, perhaps.
Yeah. Yeah. Hopefully one day I will be able to visit the Poltekkes in person and not just online. Yeah.
Right. Now we can give to our master of ceremony or to continue this conference. Thank you so much, Mr. Ngurah, and see you in other event.
Thank you to our speakers, moderators, and all participants. We will take a short break and we'll be back again at 1 p.m. Thank you.
Di close aja ya. Soalnya nggak di sini ya. Ya, sudah close aja. Iya. Tadi. Oh iya.